Good morning, everyone. Please take a seat. Please take a seat. Just a reminder, again, please reserve the seats at the desks for members of both appropriations committees. We may not be full right as we start this morning, but due to the interest in several of the presentations this morning, I suspect we will fill up from time to time. So again, I would just ask that if you're not on the Appropriations Committee, if you would allow your seats to be used by those on the committee so that they can make notes and be able to look at their books and everything. So good morning. Hope everyone had a good evening. I don't know if Representative Holmes had a premonition or not or something or other, but she has Doctor of the Day here today, and I don't know if she felt like that we may need one today at some point, but anyway, I want to turn the podium over, and I've warned her she's got 2 minutes. I'm not sure she knows what 2 minutes is, but anyway, Representative Holmes, please introduce your doctor.
Thank you, Chairman and Chairman Hill. I appreciate very much my 2 minutes today. And I have a very special guest as Doctor of the Day. He's a very special friend of mine, Dr. Chris Maduri, who's with Piedmont Heart Institute. Last year, this time, I was facing heart surgery, open heart surgery. And as you know, a long recuperative period and painful. And I, through a mutual friend, met Dr. Maduri, and long story short, he has perfected this wonderful procedure called mitral valve clip. Instead of being in the hospital for quite some time and having a painful recovery, I was in Piedmont one night. I was back in the session in a week, and I just want so much for y'all to know this wonderful man. He and his associates have saved lots of lives. He's a wonderful young man who meant so much. And today, this week, with all of the healthcare folks here, I just want to thank you all for what you mean. And Dr. McGurry is going to speak to us for 1 minute.
Thank you for those kind words, Susan, and I'll be less than a minute. I thank you again and for the opportunity to be here today and appreciate all of your service to our state. Again, it's truly an honor, and if there's any way I can ever be assistance to any of you, please feel free to reach out to Susan or anyone else. And I wish you the best of luck balancing this budget. So thank you very much.
Thank y'all. Well, okay, ladies and gentlemen, we've got a full morning, a lot of things on the agenda this morning, and a lot of in-depth discussion, I'm sure. So as we get started today, we have Commissioner Robin Crittenden with the Department of Human Services and Tom Rollins, the Director of DFACS and Department of Family and Children's Services, to make a presentation on DCH and DFACS and Child Protective Services. So, Commissioner, we're glad to have you with us. Thank you for being here. Thank you both as we get started for the work y'all do every day in our state and taking care of those young and old. So, the podium is yours.
Thank you very much. Good morning. Good morning, Chairman England and Chairman Hill and committee members. Thank you for this opportunity to come before you to discuss the governor's budget recommendations for the Department of Human Services for the remainder of the current fiscal year and for state fiscal year 2021. My name is Robin Crittenden, and I am the DHS Commissioner. Members of my leadership team are here with me today, including our Chief Financial Officer, Demetrius Taylor, Budget Director, John G., and Legislative Affairs Director Jackie Tate. Director Tom Rollins is also here to present the governor's recommendations for DFACS. I have had the honor of presenting to most of you before, but for those of you who may be new to the committee, or for those of you whom I may not have had the opportunity to meet, The Department of Human Services' vision is to build stronger families for a stronger Georgia. We provide individuals and families with access to services that promote self-sufficiency and independence and protect Georgia's vulnerable adults and children. With each policy, program, and service we provide, we ask ourselves, does this help build stronger families and, as a result, a stronger Georgia? With that in mind, here's how we use our resources to accomplish our goals, adhere to the laws governing our programs, and hold ourselves accountable to the public trust. DHS has about $1.7 billion allocated to protect and serve Georgia's vulnerable populations. When you add the budgets of our attached entities, the total for the department's fiscal year 2020 budget allocation is $1.9 billion. Now we will look at the governor's recommendations for DHS and two of our attached entities, the Council on Aging and the Family Connection Partnership. Georgia Vocational Rehabilitation Agency, GVRA, is also attached to DHS for administrative purposes, and Executive Director Sean Ryan is available should you have any questions for him. Overall, for DHS, the governor has recommended an amended fiscal year 2020 budget of $804.2 million in state funds and $800.7 million in state funds for fiscal year 2021. This amounts to, for amended fiscal year 2020, a reduction in expenditures of $25.4 million, and for fiscal year 2021, a reduction in expenditures of $28.9 million. First, the governor's recommendations include common changes or statewide adjustments. These include Department of Administrative Services self-insurance programs, teachers' retirement system adjustments, the Georgia Technology Authority administrative fees, the Department of Administrative Services cybersecurity insurance premiums, and a $1,000 pay increase for full-time employees who make $40,000 or less. Overall, the governor has recommended a reduction in spending of $25.4 million in the amended fiscal year 2020 budget. For our Division of Child Support Services, the governor's recommendations include $1.2 million in savings in personnel costs resulting from employee turnover. These funds will come from the savings that occur between the time a person leaves a position and the time the position is filled. We call this vacancy lapse. There is also a reduction of $19,900 in projected travel expenses. This reduction does not include day-to-day travel required to perform basic job functions. The governor has also proposed reductions in departmental administration, including $880,000 for contracts in our Office of Information Technology, $896,695 for savings caused by the vacancy lapse, as I described earlier. This departmental administration number does not include vacancy lapse for DFACS administration. And finally, a $164,800 reduction for the Georgia Memory Net project. Also, for departmental administration, the recommendations account for replacing $160,000 in state spending for aging services initiatives with funds from the Social Services Block Grant, or SSBG. This includes two projects, the first addressing senior hunger and the second to encourage innovation in senior centers. You will hear this again because these projects were funded in 3 separate program lines, which will all be replaced by SSBG funds. Additionally, the governor has recommended a reduction of $22,400 in travel and conference expenses. As I previously stated, the proposed travel reductions do not include day-to-day travel required for staff to perform basic job functions. These are efficiencies in travel related to conferences and other similar items. In elder abuse investigations and prevention, the governor has recommended the following reductions: $956,000 in savings in personnel costs resulting from vacancy lapse, and $1,322 for savings in travel and conference expenses. Again, this has no impact on the travel required to conduct adult protective services investigations or other travel required for basic job functions. For the Elder Community Living Services Program budget, the governor has recommended replacing $75,000 in state spending with SSBG funds for the senior hunger project I mentioned earlier. For elder support services, the governor has recommended replacing $195,000 in state spending for the senior hunger and senior center innovation programs with SSBG funds, and a reduction of $497 for savings in travel and conference expenses. For residential child care licensing, the governor has recommended $5,741 in savings in personnel costs from the vacancy lapse. Now, I will move to the governor's recommendations for DHS in fiscal year 2021. Overall, the governor has recommended a reduction in spending of $28.9 million in the fiscal year 2021 budget. For our Division of Child Support Services, the governor's recommendations include $1.8 million in savings from vacancy lapse, and there is also a reduction of $30,044 in projected travel expenses. Again, this reduction does not include day-to-day travel expenses. Proposed reductions in departmental administration include $1.3 million for contracts in our Office of Information Technology, $1.4 million in vacancy lapse, and in vacancy lapse, which does not include DFACS administration, and then a $247,200 reduction for the Georgia MemoryNet project. Also, for departmental administration, the recommendations account for replacing $160,000 in state spending for aging services initiatives with funds from the SSBG. This includes the two projects mentioned before, one addressing senior hunger and the other to encourage innovation in senior centers. Like before, you'll hear this again because these projects were funded in 3 separate program lines, which will all be replaced by SSBG funds. Additionally, the governor has recommended a reduction of $20,700 in travel and conference expenses. These are efficiencies in travel related to conferences and other similar items. In elder abuse investigations and prevention, the governor has recommended $1,983 in savings related to travel and conference expenses. These last 2 items reflect the same state funding swap for SSBG funds for the senior hunger and senior centers programs. In elder support services, the governor has recommended a reduction of $94,920 in expenditures associated with marketing for the Aging and Disability Resource Connection, or ADRC, and a reduction of $745 in travel and conference expenses. The governor has also recommended redistributing existing funds in the department to align budget allocations with actual expenses. This includes funding 2 existing positions currently allocated to departmental administration, which will be transferred to the residential child care licensing budget, and funding for 1 existing position currently allocated to departmental administration to the Council on Aging's budget. The governor is also recommending combining the Elder Support Services Program budget with the Elder Community Living Services Program budget. The governor is not recommending a change in expenditures here. It's just a recommendation to combine 2 program budgets that cover the same services, such as home and community-based services and Medicare counseling. Finally, the governor's recommendations for the department include reductions for the Council on Aging and the Family Connection Partnership, both of which are attached to the department for administrative purposes. I will briefly cover those recommendations before I conclude my presentation. The governor's recommendations for the Council on Aging, which is led by Executive Director Kathy Floyd, includes a reduction of $12,451 in fiscal year 2020 expenditures. This accounts for savings in personnel costs resulting from employee turnover. As with other changes of this nature, we refer to this as the vacancy lapse. Also, in fiscal year 2021, the governor has recommended 2 changes for the council: a reduction of $11,000 associated with a media contract, and a reduction of $4,298 for the elimination of 1 council meeting during the year. As I mentioned earlier, in federal fiscal year 2021, $71,391 is being transferred from departmental administration to the Council on Aging to fund an existing position. The governor's recommendations for Family Connection Partnership, which is led by Executive Director Gay Smith, are as follows. In the amended fiscal year 2020 budget, the governor has recommended a reduction of $318,000, which will result in a decrease for each county collaborative of $2,000, and a $56,000 reduction in technical assistance to the counties. For fiscal year 2021, the governor recommends a reduction of $477,000, which will result in a $3,000 decrease for each county collaborative and an $84,000 reduction in technical assistance to the counties. That concludes the governor's recommendations for the Department of Human Services amended fiscal year 2020 and fiscal year 2021 budgets. Before I turn the presentation over to Director Rollins, I want to encourage you to visit our website and read our annual report for fiscal year 2019 and the Division of Aging Services Just the Facts report. Both publications cover our accomplishments and our impact across the state in the last fiscal year, none of which would have been possible without your support, the support of the governor, our partners, and of the very dedicated people that work at DHS. You can find both reports at dhs.georgia.gov. I'll be happy to answer any questions you may have after Director Rawlings' presentation. Thank you.
Okay, we've got about 29 minutes. So, Director Rollins, thank you for being with us. And I just would ask both of y'all to give us some time because we do have several questions.
Thanks, Mr. Chairman. I got my timer set for 15 minutes. So, whoops, well, it was set for 15 minutes.
Time's up.
Let's go. Well, good morning, everybody. I'm Tom Rollins. I really have the honor of serving as DFACS Director and appreciate our work with DHS, and I really appreciate Governor Kemp allowing me to work in a field that I love, absolutely love what I do. And I love working with the thousands of Georgians who are helping me to keep children safe and to get folks who are in a vulnerable situation to a situation of independence, financial independence, where they can take care of their own. We have a budget for amended 20 and 21 that I think is reasonable and that will allow us to focus on our core missions. So let's go over those real quick. For amended 20, we are going to start off with, let's kind of go through the various reductions here, the 4%. First, we are going to reduce in adoption services essentially one full-time employee. Of course, this will be by not hiring someone. That's $40,000 or out of a $100 million adoption budget, most of which, of course, is funds that are used to support prior adoptions. I will say that our adoptions went up this year to record numbers. 1,400 children were adopted from Georgia's foster care system this past year. In child welfare service, we're going to reduce some legal costs that we fortunately did not spend this last year that were associated with our Kenny A consent decree, which is also something that we're working very hard to get out of this year. In child welfare services, again, we are able to save $249,000 in state funds by shifting a federal grant to fill that slot. In child welfare services, again, in our supervisor mentor program, we are eliminating some vacant positions, or at least not filling them for now. Those are 6 out of 62 positions. So as you can see, a very minor, about a 9% cut in that particular program. Also in child welfare services, we have 30 vacant positions that will save us at about $2.1 million this coming year, this fiscal year. Now, understand that when we talk about vacant positions, what we have been focusing on is leaving vacancies at the state and regional level. There's one place where we have to keep pretty much full employment, and that's on the front line. It is those frontline workers who interact every day with the families of Georgia, who protect children, that we have to keep those guys so that they're working hard and that they don't have a caseload that's too high. And this budget allows us to focus on filling those frontline positions, and in fact, we are really doing well in terms of that hiring. Also on the next page, just make sure we're on the same place. Here we are. Yes, thanks, John. On child welfare services, reducing funds for foster parent recruitment. Essentially, these are some ads we're not going to buy, some media campaign we're eliminating for now. Again, in child welfare services, reducing funds for 6 vacant foster care support services positions. These are, as I said, vacant, and this would be 6 out of 44 existing positions. And we were able to save $2.4 million by basically shifting some TANF dollars to fill state dollars. We're part of a larger statewide transportation contract, and really we found that was not something that was part of our core mission in our division, and we were able to eliminate those funds. We're also shifting some TANF funds that we're covering some contracts that will allow us to essentially save another $970,000. Again, on the next page, we were still in child welfare services, reducing some travel expenses, and understand that, as Commissioner Crittenden said, when we talk about travel expenses, our viewpoint was that we're looking at travel expenses that would otherwise be associated with those vacant positions. So we could just put it all in one lump, but we've divided it out. DFACS administration, reducing a little bit there. Again, I think nobody is going to be concerned if we have fewer people at the state office in terms of vacant positions. We want to focus on those frontline positions. We were able to save money that we did not need to use for the Gateway program. That's a savings of $4.9 million. And the next thing just says yes instead of having some red numbers there. is that we took on about 220 employees who were part of the Right from the Start Medicaid unit that had been assigned to DCH. We brought them on board using existing funds. So we've actually been able to bolster our workforce in that way. In out-of-home care, I think many of you will find this interesting. We are actually asking this year for a $6.7 million cut in out-of-home care. I can tell you last year this time, we came to you with an amended budget request asking you for $10 million additional in out-of-home care. In fact, we have been able to reduce our foster care population since March of 2018 by almost 2,000 children. And I'll be happy to discuss with you how we were able to do that, because I think we have done it in a way that is safe and proper and focuses on the needs of families. Finally, on this last page for amended 21, just a very small change, some funds that weren't paid out, $30,000. If you look at the total state funds reduction for amended 2020, that's $18.9 or $19 million. And so we're going into 21. I don't want to repeat myself, and I think, so what I want to say is the boxes that have been checked, and we'll kind of go through these rapidly. The first page, John, the second page, and the third page, and really the first 3 pages there. These are continuations, of course, of the cuts we're making for 20. So we'll continue those cuts, same amount of money essentially. What we do want to get into, of course, is the changes, the additional 2% that comes with the 2021 budget. So in federal eligibility benefit services, essentially these are eligibility workers, we are cutting about 105 vacant positions. Now, the question you may say is, can you do your work with that? Many of you, or some of you may have met Sean Thomas, who is now the head of our Gateway program. She has done amazing work in the last months, really specifically at Governor Kemp and Commissioner Crittenden's request, in terms of taking actions that are going to speed up our eligibility services, that are going to make them simpler, that are going to really automate some projects. So I feel confident that we're going to be able to meet our obligations to get folks the benefits they need in a timely and accurate manner with the staff that we have. In terms of the next line, of course, is travel expenses associated with those workers. And child welfare services, again, reducing funds for 127 vacant positions. These would be through attrition, again, focusing on ensuring that we have frontline workers that we need, and also focusing on making sure that DFACS is doing its core mission in child welfare, which is keeping children safe when they have been maltreated. What does that mean? It means that we work hard. It also means we work very closely with other agencies. When we have children who have mental health needs or perhaps delinquency needs, when we have families that have poverty issues, housing issues, we are doing a much better job, I believe, of working more closely with our sister agencies. Our State of Hope program, which is our outreach to the community, has wrapped in our family connection partners and has also brought about 150 additional community-based programs, volunteers, services, church organizations, etc., into what we call our ecosystem. We know that child welfare is a larger societal responsibility. We as an agency play a very big role in that, but we know that we cannot do that without working hand in hand with community-based partners, with philanthropies, with churches. And then, of course, the last line there is travel funds associated with those folks that we are not having to, those positions we are not having to fill. That's the presentation. Let me skip forward, John, if you don't mind, to one chart I want to show you, since I have a moment. Look at our foster care, so on one right there. If you look at our foster care numbers, going back to, say, July or really March of 18. We were up around 15,000 children in foster care. We've reduced that number to today where we have 12,609. How do we do it? We have done it because we have intentionally given our workers more discretion and also kind of eased up some of the red tape that made it more difficult for us to place children with family members that might, maybe grandmama had a criminal DUI 20 years ago and we were using that as a reason not to place with grandmama. We are working more carefully to find such things as housing assistance for folks that need housing. We know that especially when it comes to issues regarding poverty and lack of just basic needs, that we can do much as an agency to help families get what they need to care for their children without necessarily bringing those children in foster care. We think this is a prelude to our Family First Prevention Services Act work. Last year, y'all were kind enough to pass the Temporary Alternatives to Foster Care bill, and so we're working with the courts to have oversight of cases in which children are not in formal state custody, but at the same time are being watched after, have oversight of the courts, have an attorney and a guardian ad litem and a case manager to help them get through their issues. The last thing I want to say, and just kind of think this highlights the fact that our system is, our agency is one part of a larger system. We have been working with Clark's kids, or Clark Howard and Clark's kids for 30 years now on our Secret Santa program. This past year, Governor Kemp and his family were kind enough to not only get personally involved, but also to ask all of the 84 state agencies to participate. We had a record year. We gave out gifts, or got 3 gifts for at least 9,700 children in foster care, and we raised over $500,000 in donations. Folks, what this gives me the optimism that although when people, like oftentimes you hear people talk about defects, when we work with folks in the communities and show them what our frontline workers are doing in terms of the good they do for the people that they serve, those folks step forward because they understand that this is work that we can't do alone, that these children are vulnerable, that these children need help, and it is so nice to see people honor the work of our frontline workers by giving to the children that we are serving. So I think that's a great thing for Georgia to see us all come together, and I'm sure that we'll be ready to answer any questions you might have.
Okay, we do have a few. Representative Al Williams.
Thank you, Mr. Chairman. Thank both of you. I've got a question for each one. Dr. Winton, if you could answer this for me. I'm always good to see you. Think you do a great job. I'm concerned. We have a lot of unfilled positions that have been knocked because they are not filled. My question really is to both you and DFACS, but you first. Is it that you can't find anybody to work? Why are we having all these vacancies, or what's the situation there? Then I have a question for DFAC.
So just, if I could, thank you for your question. First, if I could clarify, for the DHS, for the portion of the agency that I was talking about, we are not eliminating any positions. What we are realizing savings from is from the time when someone leaves until we fill the position. And so that's where the savings, we're not holding positions, we're not filling them. We normally run vacancies. Right now in our state, we have a very low unemployment rate, and people are able to find other opportunities within where they live rather than work with us. We do an extensive amount of recruitment around the state, and we are always trying to fill the positions that we have. So, but we're not creating any vacancies.
Okay. Just to follow up for DFACS, Mr. Chairman, I know that you continuously said how you're moving folk out of Atlanta. I'm right here. You, okay.
I was sitting there going, and I'm sorry, I should have put my glasses on.
You didn't see anybody that good looking over on that side. Come on.
Hang on.
You're talking about moving people out of Atlanta, and I heard that. What happens, even with your own personnel? Who do you talk to when you can't get an answer locally if you've moved all your people out and people that can really answer questions instead of computer answers or people that really don't know? I have a problem with employees who have realistic complaints, and you certainly can't complain to the person that spanked you. So if you lock down in a county, and you've sent all your front line, everybody's front line now, you know, so the Pentagon's empty. So who sends the orders?
Where are the generals?
Yeah, where are the generals?
Yeah. So what we're doing, we've been working very hard for the last year and a half on our culture, okay? That means that, number one, there has traditionally been in child welfare and a lot of bureaucracy sort of a culture that if you're afraid to speak up because you might get shot down. We have been working very hard to make sure that people know that not only do I got a special email inbox, people call me all the time. I and my leadership team actually go out and talk individually and separately to frontline workers because those are the folks I really care about. I mean, I love my state level experts. I love all the folks at the state office who can help solve problems, but I know that when the rubber meets the road, it is that frontline worker. You go back to the vacancy issue, one of the issues we have in child welfare, not only in Georgia but nationally, is turnover. And so if we can create a culture in which folks are staying with us because they feel cared for, because they feel like they got a reasonable workload, and because they feel like they got somebody to complain to, which is what our supervisor mentors and a lot of our mentorship programs are all about, then they're going to stay with us longer. They're going to get better at what they do. They're going to get wiser in making decisions. So I think that, you know, the question is not so much one of getting people out of Atlanta. It is making sure that when you are running a bit of a tighter ship, that you ensure that the people who are carrying the real workload, the most stressful workload, are in fact at full employment, so to speak. And because we do have turnover, we have to continually recruit for those positions. I'm sorry I didn't have my glasses on. I literally was looking around for 2 minutes trying to figure out where that voice was coming from.
Chair Lady Dempsey.
Yes, thank you. Good morning for all that you and the entire agency do. I know. I hear a lot about it, and we'll hear more next week, so that will come forward. But I did have one question, which is particularly in some of the impacts of the senior functions that are so important. So I just wondered if SSBG, Social Services Block Grant money, is going to absorb some of that. Was it? And what those funds might have done or might not be doing.
So the funds that I was talking about, were for 2 programs, and we are just doing a fund swap into SSBG. The first one has to do with some of the work. Some of you may be familiar. We've been doing a lot of work these last few years around senior hunger and with the National Foundation to End Senior Hunger. So we'll be able to continue that work, and they were working with several senior centers, more than several, 38 senior centers actually, around the state on various things associated with senior hunger. The other project that funding is being used for is senior center small innovation grants, where senior centers from around the state are able to apply. They're competitively done for these small grants, and they will do things that are important in their senior center or needed in their senior center. We've seen things like equipping a food delivery truck with a refrigerator with the funds. We've seen things like diabetes education in the senior center, just various things. They apply for those, and all of those funds are being transferred to SSBG for both of those programs.
Senator Freddie Paul Sims. Senator Sims. Was that an inadvertent button push? Okay.
No, it's
Representative Stovall? Your light wasn't on. Everybody else's around you is.
no.
All right, go ahead.
Thank you, Mr. Chairman. I have a question for Commissioner Crittenden, and thank you for all the work that you and your staff are doing. You're very responsive whenever we have issues in our community. It's almost a follow-up question to Chairman Dempsey, but I had a concern about the technical assistance portion that's going to be reduced. I want to know, how were the counties using the technical assistance, and how would that end up affecting them by them not getting receiving those funds? And then I have a question for Director Rollins as well.
Okay. Those funds are for Family Connection Partnership, and so Gay Smith, who's the executive director there, would really be better able to answer that question for you. Unfortunately, she could not join us here today, but I will pass on that you have a question for her. Thank you.
Thank you. And Director Rollins.
Yes, ma'am.
I know we've had several conversations about my concern with counsel for convenience. For those counsel for convenience, when contracts that's been canceled with the organizations that have been having contractual services for providing services for the community. And my concern is that now with the reductions in the budget, are we going to see more of those contracts canceled without informing the organizations prior to it, when they didn't even have any issues going on with them, but they were just canceled?
No, ma'am, I don't believe so. I think that if we look at the overall budget, we have been able to sort of focus our budget on providing services. And of course, I like to think that we talk with our contractors prior to ever canceling a contract for convenience or any other way. I know that you and I have had some discussions about that, and I do think there have been some miscommunications in the past. But I do see us as continuing. If you look at the overall budget, especially in child welfare, you're talking about $800 million. I think we'll be able to continue to focus our funds and our effort on getting the services to the people we need. The more that we can provide, for example, with the community-based contractors, the more that those folks can help us, the less likely we are to have to bring a child into foster care. And the less likely, and of course, that means that everybody's safer, everybody's happier, the family's together, and it's simply a better solution for all.
Time for one last question. We're running out of time. Of course, subcommittees will be meeting over the next several weeks, so y'all have plenty of time, or if you got something that's pressing today, please catch the folks in the hall as they get ready to leave. But our last question for the Commissioner and the Director, the Governor's Floor Leader, Dominic LaRicchia.
Thank you. Thank you, Commissioner Crittenden and Director Rollins.
Yes, sir.
You know that we've worked really hard over the last couple of years to add funding to be able to support existing caseworkers and hire more. I guess my most important question would be, looking at some of the reductions in these areas, looking at some of these cuts, we're hearing stories, in particular down in rural South Georgia, of as many as 30 to 40 cases per caseworker. And this is coming from juvenile court judges and SAGs and guardian ad litems. Specifically, how do you, what is the average caseload now, and specifically, what are you going to do to try to recruit and retain more of these caseworkers to get that caseload per caseworker down to the average with these cuts? Sure. And what's caseload average now?
So the average caseload overall is 19, but I think that's kind of it's sort of like living on Mars. The average is probably 68, but one day it's 200 degrees, the next day it's 200 below zero, depending on whether or not you're facing the sun. What I can tell you is this. We have, because of the Kenny A lawsuit, we have lower caseloads up in the Atlanta area. And so we do find that out in somewhere, especially in the rural areas, we have higher caseloads. What we have done already to deal with that is to, of course, the boost in pay y'all gave us a few years ago was very helpful. We began continuous recruitment about a year ago. And thanks to the continuous recruitment, we have really bolstered tremendously the number of active employees and have cut down on the vacancies. We still have a way to go, and I think rural Georgia, where I'm from too, is probably one of the harder nuts to crack because of the good economy and because of the fact that I think, as with any government organization, our hiring process is a little slower than the private sector. But we have worked very hard. Carol Christopher back here, I put her in charge of a team working this past year to really speed up hiring and to make sure that we were advertising and to make sure that we were doing it continually. And I think that has helped, but we do have a little ways to go. But I can assure you also that these budget cuts are not going to affect those positions. We need to reduce those caseloads, but also we need to reduce those workloads. It's not just a matter of caseloads. So the other thing that we have been doing is what we call simplification process. We often find ourselves involved in cases and sort of going through a lot of paperwork and doing a lot of papers pushing that did not involve giving folks the ability to go out and see the families and do the work necessary and then get back to the office. So Mary Havoc, who's my Deputy Director of Child Welfare, has been working very hard, especially in the last 6 or 7 months, to reduce the administrative load to get us really, for example, we'd have a case where we'd get a complaint on it. We could tell there was nothing wrong going on in the family, but yet we'd still make our caseworkers go out and talk to everybody and his brother and get involved in the family's life, and it wasn't really necessary, just to make sure we had gotten the paperwork completed. So we're cutting down on stuff like that, as well as I said, trying to bolster our frontline caseworkers. And so if we can get that balance where those folks have the discretion they need to do professional work, where they're well mentored, where they feel like they're cared for, they're going to stay a long time. But we do, I agree with you, we still have a way to go, especially in rural Georgia.
Okay, that concludes our time. Commissioner Crittenden, Director Rollins, thank you and your team for being here, and thank you for what you do every day. Director Rollins especially, you have one of those jobs in state government that it takes a special heart and to do. And it's one that it's one of those 2 or 3 in state government I just don't know that I'd want to have. So, but I appreciate it.
Thank you,
I really do what you do. Thank y'all. Next up, ladies and gentlemen, we have Dr. Kathleen Toomey, who is the Commissioner of the Department of Public Health. If y'all will allow her to make her way up front.
Yeah.
Okay, ladies and gentlemen. We're on a tight time frame this morning, so please take your seats and direct your attention to the podium. And Dr. Toomey, glad to have you with us. And the podium at this point is yours.
Oh, thank you so much. It's a privilege for me to be here today, and I thank you so much, Chairman Hill, Chairman England, and the members of the committee. Some of you may remember that I was not appointed until the end of session, so I've never had the pleasure of a budget hearing before. So although I can't say I'm new anymore, this is my first budget hearing, and I appreciate the opportunity to talk about public health and the work we're doing. and the challenges ahead. In the first slide, I want to show a map that's familiar to you, but perhaps you don't see this very often. This is Georgia, but broken up into the public health districts. We have a very unusual structure for public health in Georgia, probably like no other state in the country. We have 159 independent boards of health that report directly through the CEO, which is the district health director, but the district health directors are state employees, and they report to me. So in essence, I have 1,000 state employees and 6,000 Board of Health employees that indirectly report to me through the district health directors. That leads to, I think, some challenges in terms of management and coordination, but tremendous opportunities for us if we can create a system of public health that can serve the state as a whole, as a seamless system throughout the state. You may not be aware that I was actually a health director for 3 years prior to coming to this position. I was the health director in Fulton County. And coming from that position into the commissioner's job, I think has given me a different perspective of what some of the opportunities are for us here at the state. And when you have the opportunity to meet your health directors from your districts, your home districts, I hope they'll let you know that I have worked very, very hard to try to strengthen the relationship between the state office, the district office, and the counties. Because for us to be effective at what we do, we have to work as one team across this system of health. And I'm very proud of that work that we've done, and I feel that we've made great strides in the last 9 months that I've been here. In the next slide, I wanted to just point out what some of the challenges have been in the past year, because this last year was one of the most unusual years in public health, and even after this was printed, we have a new challenge, coronavirus. You may be aware that the airport has started to screen passengers for coronavirus. Public health is engaged in that activity. We will be called when they identify someone potentially infected, and have already lined up our hospitals to assist us with that work. We will probably eventually be doing testing for this in our public health laboratory. Right now, the testing is being done at CDC. But this is the kind of agility we have to have in public health to be able to respond to unexpected events like coronavirus. Last year was, as I said, quite an unusual year for me, who's worked in public health for many years. We were one of the states with a large measles outbreak. I don't know if you're aware of this. We actually had a second large outbreak of 11 people right around the holidays, the Thanksgiving holidays. An outbreak like that requires enormous effort, public health effort on the part of staff to follow up to ensure the safety of individuals exposed. This was an unusual situation because many physicians have never seen a case of measles, let alone followed up on an outbreak. And so I think this is something we need to be aware of and see what we can do to try to prevent future outbreaks like this. Influenza is in the middle of influenza season. We have had many hospitalizations, over 500 hospitalizations, 6 deaths already this year. So we're only halfway through the flu season, and we're seeing record numbers of cases. You may not be aware that we are experiencing a hepatitis A outbreak in the state and in adjoining states. We are doing a better job, I can say, of controlling that outbreak than our adjoining states in Florida or Tennessee. But the hepatitis A came into Georgia probably near the Tennessee border, worked its way down through the state, metro Atlanta area, and then into the Augusta area. We have actually vaccinated over 71,000 people to prevent hepatitis A, contracting hepatitis A, and we've had over 835 confirmed cases. So it's really quite a large outbreak that we feel we have control of at this point. We had the largest Legionella outbreak in Georgia history last year, which led to the closure of a major Atlanta hotel. That made news, national news. It was, again, something else that demonstrated the effective working relationship between state, local public health, epidemiology, environmental health, as well as the EPD. So I think this is, again, the kind of agility we need to have to ensure and protect the health of the public. And last of the kind of outbreak and investigations we did, I have to raise the issue of EVALI. None of us have ever heard of EVALI before a couple years ago, and that's the e-cigarette vaping associated lung injury, which now has become something that we are dealing with, but still don't understand why it happens and exactly what are the causes. We've had five deaths from that in Georgia, over 40 cases, and are still identifying cases. So these are just an example of the kind of outbreak and investigations we've had to deal with in a very unusual year last year. I also wanted to point out that the other thing that we do in public health that makes us a little different than other agencies is we literally touch every Georgian with our work. And we do that because we inspect every restaurant, whether it's the Sloppy Floyd cafeteria, the Grady cafeteria, or the restaurant down the street. Our inspectors inspect those restaurants, and so we're protecting the health of the public by ensuring that those restaurants are safe. Clearly, we do septic inspections, and one of the important things that I see for us by having a system where we ensure this coordination between the state, district, and local offices, and that those inspections are consistent. If you're a contractor working in one county, that you should expect the same standards in an adjoining county. That shouldn't be 180 degrees different. Or if you own a franchise food chain, you shouldn't have different inspection standards. That there should be some consistency and high quality across the board through public health. 130,000 babies are born every year. We touch all those infants through metabolic screening done at our public health laboratory. And thanks to your support last year, we now screen 30 health conditions, which is more than many states offer. And we're really proud of that work that we do. And we also are doing home visitation, which is something that public health used to do in years past, and we see as a real, an important opportunity for us to be having an impact on both mothers and babies and social and emotional development of our infants through working in the home. Last, I just wanted to raise the issue of disaster preparedness, which you probably don't think of public health as being a key part of disaster preparedness, but in fact we are. And for those of you who live near the coast, you'll remember during Dorian, we had a major, I call it a full-scale exercise because we fortunately weren't affected by the hurricane, but we did do a major evacuation and set up multiple shelters. Public health has a very important role in that work, and I was so impressed by not only how well the districts and counties work together with the state office for that to happen, but also how the agencies across the state, GMA and the other agencies who are responding to disasters work together. We should be very proud of our capacity within the state to respond to disasters. And clearly the Super Bowl, think of as a disaster, but required an enormous amount of preparedness. Well, enormous amount of preparedness on the part of public health, everything from restaurant inspection to actually testing for bioterrorism agents. And before I get into the meat of this, which is the budget, I do want to talk about our priorities because I think it's important for you to see the frame of reference, the lens through which we're looking at our budget. When I came on board end of March last year, early April, I started to have program reviews to get a better sense of what was happening in Georgia Public Health, and engage the districts as well as all the internal programs. And looking at the data, I am an epidemiologist by training. Looking at the data, it was very clear to me what our priorities have to include in public health. You know, one is maternal mortality and morbidity. We have among the worst rates of maternal mortality in the country. We can do better. We have looked in public health at opportunities to begin doing prenatal care, have a group working in partnership with the Georgia OBGYN Society to start that process through telehealth, telemedicine, working with OBGYNs, not in competition with OBGYNs, to provide services in the many counties, I think 80 counties, with no prenatal care. I think that's one example where public health is back to the future. Public health used to provide prenatal care. I think it's time that we need to get that capacity in partnership with our medical colleagues. Infant mortality and morbidity is another area where we sadly are at the bottom, again, of other states. We have among the highest rates of preterm and low birth weight babies born in Georgia. We see our work in home visitation as well as the prenatal opportunities as a chance for us to shift these poor outcomes. And last but not least, I want to raise the issue of HIV. You may not be aware that 50% of new cases of HIV in the United States occur in the South, and Georgia has among the highest rates of HIV in the nation. And so that we have to address HIV as one of our top priorities, and it certainly affects the other areas as well. How we will do this will include not only just our collaborations with CDC and the work we're doing in the Metro Atlanta area through our work with CDC, but building from that CDC work to spin off what I hope will be some important models for the rural Georgia, because there's some high rates of HIV in rural Georgia that are similar to those in Metro Atlanta, although the numbers are not as high. And so we have our challenges in Dougherty County, Muskogee County, as well as Fulton, DeKalb, Gwinnett, and Cobb. And so these were the areas that we wanted to focus on initially as we work together to address all the other areas of public health and public health work, working together with the counties. Now what you've all been waiting for, the budget. There are a few points I wanted to make as you look at some of these pie charts. One is, if you look at our appropriation, we are not a top-heavy organization. We do not have a lot of money in personnel. Our money is largely 65% is in direct services. And so that makes it a little different than some of the agencies that I'm sure you've heard from. Our contractual services are also, in large measure, direct services, the HIV drugs, the perinatal centers. And so we have kind of a budget that's heavy on direct services and relatively light on personnel. The next pie chart that shows another good news, bad news story. The good news is 60% of our budgets are federal funds. And that allows us an opportunity to move into areas that the state may not be able to support us in. The bad news is federal funds often require us to have some sort of match or state maintenance of effort. And as we look to prepare a budget to present to the governor, we worked very hard with programs to ensure that whatever reductions we were making would minimize cutting any federal funds. And you can't always do that. Not every federal program may be worth doing, particularly in a tight budget year. But that's one of the challenges we have, that we want to make sure that we at least minimize the risk of reducing federal dollars. The final point on this, if you look at the state general funds, which are 40% of our budget, 46% of the state funds is actually grant aid to the counties. So the county funds represent tremendous proportion of our state budget. And that's just the facts. And that was one of the reasons why when we began to look at the budget, we were very transparent with the health directors. And they will tell you so. I mean, I talked with them about it and how we will work together to try to make reductions, and that we couldn't begin to think about this without including some thought of how to include the grant aid as part of that reduction proposal. If you actually look at our governor's recommended summary, which he proposed, the total cuts for 2020 are almost $11 million. So $10,994,668, and for 2021, $12,599,587. The great majority of those cuts, as I mentioned, are to the public health formula grants to counties. That's the biggest kind of chunk of reductions, because that is the biggest proportion of our state budget. And as I also wanted to point out that, you know, as we looked at this, as we went through our budget process, you know, we were dealing with some fiscal challenges even before we were given our budget instructions. And I imposed fairly severe travel freeze for state dollars, a fairly robust personnel critical hire process. And so we have shown tremendous fiscal responsibility in public health even prior to the budget instructions. So I want to reassure you on that as well. That was part of what we've been doing over the last several months. But I do want to talk in more detail about the grants to the counties, because I'm sure that's something that's on your mind, and you may have heard from your counties already about their concerns. Again, I do want to reassure you that this was not done without discussions with the health directors, who have promised me that they will work very diligently to ensure there's no reduction in services. There's enough flexibility with the way grant and aid is provided to the counties, that they will have the flexibility on their end to adapt to the needs and opportunities they have there at their specific county area. They have some flexibilities we don't have at the state office, in that they have county match or overmatch with county dollars as well as revenues, because they collect fees for septic tank inspections or food service inspections or the delivery of clinical services, and those funds are their own funds to keep. Those do not come back to the state. So they have some flexibility in their own local dollars, as well as several of them have direct funds from either foundations or federal grants. And so that's not to minimize the impact, but it's to say that I feel that I can stand up here and say that I've worked closely with the health directors and feel good about the fact that we as a team have committed to minimizing any impact this reduction will have on the delivery of services at the local level, which is where the rubber meets the road in public health, and is really what we're all about in our work. You know, to me, the state office supports local public health. That's our job, that's my job, and that's the message that I have conveyed to my staff. And so just to conclude, I just want to thank you. It truly is a privilege to be here in this position at this time. I really thank you for the support you've given public health over the years, and I hope you'll continue to support us in our work and support us as we respond to coronavirus and everything else that comes our way in the coming year. So thank you very much.
All right. Thank you, Dr. Toomey. We've got a few questions. We're really limited on time. Vice Chairman Perkle.
Thank you, Mr. Chairman, and thank you for your presentation and for putting a pleasant face on a really tough subject matter. The front line of healthcare in rural Georgia is our county health department.
That's right.
There are many, many counties in this great state that do not have a doctor, but every one of them has a county health department. They have a health professional on site and provides health services in a lot of our communities. And I mean, so the big one that you talked about, I mean, I see $15 million in cuts to the county boards of health. And I'm sure you're aware that many of the cuts in many of the counties, if we're going to transfer some of the responsibility onto the counties to maintain those from the state, then some of these counties have a difficult time keeping their lights on. So additional monies for our public health departments will be difficult on the ground level in some of our counties. But thank you for your positive outlook on a tough subject matter. But it is tough.
No.
Cuts of this magnitude to our county health departments will be difficult.
Okay. Senator Davenport.
Thank you very much, Mr. Chairman. Thank you, Commissioner. I'm real concerned about these millions of dollars of cuts to the public health in the recommended budget. But more specifically, Clayton County, we have a concern there about this consolidation of the public health department. And I know you talked about delivery of services, and we really want that. But I guess our question is why Clayton County?
Now, I feel actually very good about that, and I would have recommended the consolidation even without a reduction. You know, and that reduction is taking away the health director, but having the health director's duties being assumed by the adjoining district, which is Dr. Obasanjo's district, which has really runs a gold standard health district. We have not been able to hire a health director there for over 2 years. And there were times when I know that they were very difficult. We were having a difficult job delivering services in Clayton because many of those patients were spilling over to me in Fulton when I was running Fulton. But I feel that this is an opportunity for us to actually strengthen and improve the service delivery in Clayton, to learn from what's going on next door, build on that model that they're doing, actually generate some fee income that they're not doing currently. And I really look forward to an opportunity of meeting with you outside of this meeting to go into more detail about how we might do that. I mean, I think that it's less of a reduction than an opportunity to strengthen services for the citizens of Clayton.
Okay. Thank you.
Got time for one more question. Representative Glanton, you'd had your light on?
Question's been asked.
Okay, all right. So, Chairman Knight. Hold on. There we go. Try again. Try a different mic, I guess. All righty.
Thank you, Commissioner. And I really appreciate what you do, and appreciate the participation. And like I said before, you know, sort of the front line in the counties. But we are experiencing some very, very large policy issues around health care, quite frankly, deficiency, and how do we, as a General Assembly, address these issues. One of them is the mortality rate that is so prevalent in the committee studies that have been going on about that. But you guys are I want to make sure I understand this, when you're seeing those mothers and trying to get them prenatal care and trying to make sure we're getting them in, aren't you just trying to get them to Medicaid and suggest if they're Medicaid eligible, which we're trying to get them there, to get them to a physician or get them to a health care provider that can provide those needed health care services?
I really appreciate your question because it gives me an opportunity to talk about this multi-pronged effort that we're doing, not only to get women enrolled in Medicaid, to get women and their even prenatally enrolled in home visitation, which I think is going to help them and give them the support they need in the home, but also working with OBGYNs to develop a model, and we've done this in a number of counties already, and the OBGYN Society is supporting us, for them to provide prenatal care, working with our nurses in the local health departments through telemedicine. So they can do the first prenatal visit, and then our nurses can continue to do prenatal care through telehealth. So we're actually working on all of those things together.
Well, I appreciate that, but the question lies in, once you get them under or into Medicaid, okay, that's usually, is that managed care? Is that who's controlling that? That's the managed care Medicaid, correct?
That's the Medicaid program.
Okay. So at that point, our physicians or providers are limited by what managed care is telling them they can do. Is that correct?
As I understand it, but
Well,
again,
I'll bring up an issue, and I think this is relevant to the conversation. I've got a constituent who's an OBGYN that was called in to deliver a baby to a mother, no prenatal care. And DCH refused to reimburse him for the birth. He was an emergency situation. And in further getting into the issue of looking at that, talking about Henry County, how many OBGYNs in Henry County are accepting Medicaid now?
I'm afraid you'll have to ask my colleague Frank Berry when he testifies
Because
in a
what's
few,
happening...
because I don't know.
Yeah.
That's not
But
my
what's
area.
happening, and I think this is part of the bigger discussion, is the system that we have is driving physicians and healthcare providers away from trying to provide that help. It's a hindrance to our providers, and it's getting in between the patients and the physicians and doing what they can do, or it's even in some cases riding on the backs of these physicians. So again, I think it's relevant and part of the problem. And I appreciate your help in this. Thank you.
And I appreciate your comment, and particularly to again reinforce the fact we're not trying to compete with the practice of medicine or the OBGYNs. We're trying to work in partnership with them for us to be successful.
Okay, ladies and gentlemen, again, sorry, but the time is the enemy, it appears today, for the amount of interest we have. But Dr. Toomey, thank you so much for being here. Welcome on board. I know you've been on board for a little bit, but appreciate you being willing to take up the challenge, and we look forward to working with you going forward.
Thank you so much for allowing me to be here.
Yes, ma'am.
Thank you.
Ladies and gentlemen, next up we have Executive Director LaShawn Hughes with the Board of Healthcare Workforce.
You too, thank you.
She'll be presenting to us a little bit about pipeline for physicians and licensed medical professionals within our state.
Okay. All right. Nice to meet you. He's going to turn it. Come on around.
Ladies and gentlemen, if you would, please tone down.
No, it's here.
Please tone down. Director Hughes, thank you for being with us this morning, and the podium is yours.
Thank you, Mr. Chairman. I'd like to introduce the chairman of our board, Dr. Rios.
Good morning, Mr. Chairman. Thank you. My name is Antonio Rios. I'm an internal medicine physician in Gainesville, Georgia. I'm the chairman of the Georgia Healthcare Workforce. I just want to thank you for allowing us to fulfill our mission, which is to develop, train, and retain healthcare workers in our state. We are working closely with the medical school, the residency programs, to ensure that the Georgia trainees stay in Georgia. It's not an easy task. We have programs that also help to supply healthcare workers to the areas that need them the most, and for that we're grateful. I would like to recognize LaSharn Hughes, Executive Director for the board, and the team that is currently in play, who are a very engaged team and understand really the needs of rural and underserved communities, and are working along with the board to ensure that we continue to carry our mission. LaSharn?
Thank you, Mr. Chairman. So the purpose, I'm going to give some background about the board for people who don't know us. The purpose of the board is we address the healthcare needs of Georgia communities. We support the development of medical schools. We increase the number of physicians and healthcare practitioners practice in underserved areas. We do reports such as supply mix and demographics, and we also do loan repayment programs, which is a big part of our mission. This is a copy of our original budget for FY20, and we'll just keep moving on from that. Our services, we have an administrative function as a part of our budget, and in that's personal services and operating expenses for the board. We also do research out of this area. We do demographics, we go out and do site visits, we do medical fairs, we do practice opportunity fairs at hospitals, so we use this part of our budget for recruitment and retention. Our graduate medical education, these are the programs that we fund, family medicine. We also have psychiatry, which is an interest of everybody lately. And these are the people that we have under contract. So on the far right is the positions that are accredited in the state of Georgia, and these are the ones that we have under contract right by there. Continuing with graduate medical education, we also have fellowships, surgery initiatives, rural health, primary care, accelerated track. That's where the physician goes to school, get out earlier, 3+3, and say that they'll stay in the state. So we have some of those at Medical College of Georgia and Morehouse School of Medicine. We have a child adolescent psychiatry fellowship at Gateway in Savannah. We have new program development that's coming online in South Georgia, and we're doing our statewide residency recruitment as well. So this is just a slide to tell you how many residency slots Georgia has in general. So we have 3,274 approved slots that we could fill, and so far we have 2,818 that are filled in the state of Georgia. One of our other operating programs is the Morehouse Operating Grant. I'm putting my glasses on. Mercer Operating Grant. Mercer has 3 campuses, 473 students, and they're all Georgia residents as a part of their charge. They have campus in Macon, Savannah, and Columbus. Morehouse has an operating grant. That's one of our line items. They have 400 students, and 258 are Georgia residents. We have our loan repayment. We call it Physicians for Rural Areas. We give physicians $25,000 a year if they'll stay in the state per year, up to 4 years. We recently was added APRNs and physicians assistants. We give them $10,000 a year, up to 4 years to pay off their loan debt. And dentists, $25,000 as well. Our requirements are you have to be in a county with 50,000 or less for the population. So we were 35,000, but the yellow, the board voted last year to increase it to 50, so we added the yellow counties. Those are the additional counties now that's 50,000 or less. So our Physicians for Rural Health, we awarded 50 awards. We had, original award was 50. For FY20, we did 57, so we're growing that program. We've been out recruiting. Dentists, 21. APR, RNs, and PAs are 88. 88 for APRNs and 41 for physicians. And we have a federal matching grant. We give $12,500 and the feds match that. So we awarded 7 of those, 7 and then 2 last year. So our loan repayment is important because this is the debt that physicians graduate with. So we survey graduating residents, graduating students, and this is their debt. So there's 88 out of the 568 that answered, 88 had debt over $350,000. So this is why we feel our loan repayment program is an important program for the citizens. And it also gives them incentive to work in these rural areas. Our undergraduate medical education, we help pay for undergraduate medical education, $6,363 per student. And the participating medical schools you see are Emory and PCOM. PCOM has campus development. They recently opened their South Georgia campus, very nice facility. So they have funding for that as well. Our new GME program. So this is what we will see planned. We ask the programs, how will you grow? What are your plans? So I'll give you an example of a rural one. Let's see. I'll go with South Georgia Medical Education Consortium. So they're going to start with family medicine, general surgery, OBGYN. They hope to have 81 positions between now and 2025. So they're growing their programs. Each list that's here are adding more. Coliseum is relatively new, and eventually they'll have 107 residency slots. Our newest one is Northeast Georgia, and they started this year, and they intend to have family medicine, internal medicine, OBGYN, general surgery, emergency medicine, psychiatry, and they'll have a transitional year, but they'll have 194 new slots coming online. So it gives you an example of how our graduate medical education programs are growing. So on page 123 is our FY amended budget. You'll see the cuts there, $100,000 for administration, $327,961 for graduate medical education, and they're listed on your PowerPoint and in your book. Morehouse School of Medicine, we have $961. Mercer School of Medicine. Morehouse, $1,157,000. Our physicians for rural areas, this was funding that was put in last year, so we never awarded this money. $500,000 for additional loan repayment programs, and we reduced the malpractice insurance premium. That was a program that was started last year as well. So $630,000. Undergraduate medical education was $170,000. So our summary of our cuts for FY20 amended was $3,347,526, and these are the areas where we cut them. And we tried to fairly distribute the cuts across all programs. Every program was touched. We didn't just take it from one. We fairly went across all of our programs. FY 2021 budget, the governor's recommendation, it starts on 127. It just, the first is 1,000 pay raise, that's a recommendation, and the rest are personal services, reducing funds for telecommunication. Our only ask this year is for new residency slots. We have 133 new program slots, and we ask because these are programs that you've already funded, that's already been started, and we want to continue to fund those programs as they grow. Because they've recruited people to come into them. So our ask is 133 new residency slots in primary care. We reduced funds from Memorial Health. We cut our statewide medical fair. What we found out is years ago we used to have a statewide medical fair. It was very successful, but now people look for jobs on the internet. They're not showing up to the fairs. So what we do is these small opportunity fairs in the residency programs where the residents are, and then we bring in recruiters from South Georgia and everywhere to help get jobs placed. We cut contracting. We reduced funds for fellowships, startups, rural surgery, and so our cut for this area was $1.8 million. Mercer School of Medicine, we cut their operating grant. 1.4 million, we had additional funding put in, so it's really 601. We cut Morehouse, 1.7. And again, we cut the physicians for rural areas, the malpractice premium for physicians and dentists. On undergraduate medical education, we are cutting the PCOM money for 318, reduce the capitation at all of the medical schools across the board, and that was 602. And the final sheet just shows the summary for FY 2021 for the governor's recommendation, and that's 1.7 million. I'll be happy to, me or Dr. Rios would be happy to answer any questions that you have.
I'll start off with a question myself. In looking at the changes in the amended and in the FY21 budget, it stands out pretty well that many of the programs and initiatives that the General Assembly has had over the last several years in trying to address the issue of the workforce shortage in rural Georgia, that whether it's Mercer, whether it's Morehouse in rural and underserved areas, whether it's physicians' loan repayment program, whether it's the medical malpractice programs, the things that have been added over the last several years, all of those seem to be offered up. Is any reasoning behind those things, knowing that we have such a crisis in rural Georgia? We have 8 or 9 counties without a physician, period. Another dozen or so that have only one physician. We have individuals needing care from OBGYNs that are having to drive an hour and a half in one direction or another to get those services. And we've concentrated very hard in this General Assembly over the last several years to focus on trying to build that pipeline of physicians, practice extenders, OBGYNs, all of those issues, all of those areas that we've tried to expand into, but yet it seems that those things are the ones that are taking the brunt of these cuts.
Yes, sir, and the board certainly understands the need. That's what we do. We understand the need of OBGYNs, hospitals to be open, pediatricians, surgeons. But when we were asked to make the cut, we looked at the budget, and I had him put the summary up, and looked at all of our programs and tried to fairly take it. We didn't want to just take it all like from Mercer or Morehouse because I have more funding, but to fairly look at all of our programs and take a portion of it to allow to meet the cuts. And we are aware of that, Dr. Rios.
And I'm not trying to be confrontational on it. It's just that it bothers me that we all have our urban and suburban and rural friends, we've coalesced around this issue, and yet it seems to be one of the things that we've worked the hardest on, seems to be one of those things. But I understand that y'all were given a directive and goals you had to meet, and we understand that. So I'm not trying to pick on you. I'm just trying to make a statement, I guess, more than anything.
But we did look at the newer programs that we had not already funded to take the funding from the newer ones instead of the established programs where the schools and the programs had already committed to have these residents coming in. Dr. Rios.
Yeah, we share your sentiment. It's extremely painful to have to cut on some of these programs, especially the ones that we think make the most impact in helping physicians go to rural areas and stay in rural areas. But again, we were giving a directive.
Understand. Chairman Parrish.
Thank you, Mr. Chairman. Director Hughes, I want to echo what the chairman said. I'm very disappointed in so many of the cuts that are offered up as you were directed to make cuts. I understand that. But they all seem to be things that this General Assembly, both the House and the Senate, worked very hard over the last few years to make a difference in residency education around this state and other things like that. So we're going to be doing our best to take a good look at it. And one of the things I wanted to commend you on in your board is the fact that y'all are doing so much better now gathering facts so that we can know how many doctors there are and where they're located in this state, and dentists and other things too. In the past, you'd look at a community and they'd have 10 doctors in that community, but the truth of it is there might be one that's in practice, several are retired or moved away or didn't renew their license or whatever. So I want to commend you for trying to get us more accurate data and timely. And my question is this: I know we've made a tremendous amount of progress on being more current with that data. Where are we now, and just how current can we actually get? Because I know a lot of this runs when they do their renewals and that sort of thing. Could you speak to that a little bit, please?
Yes, sir. So what the board has done is change the questions. So the questions that's been on we get our data from the medical board's renewals. So the only way to get data, accurate data, is who has a license in Georgia. So we get the data from them. But we went to the Federation of State Medical Boards and asked them to give us questions from a minimum data set that other boards use, that they use on a national level. So we changed the questions to get an accurate count, because at first we counted physicians in the past. If you worked one day in that city or county, then you were counted as a physician in that county. Now we actually count the hours that you work based on a work week. So you may not have 10 actual physicians that are there. So we are working, we've changed the questions, and we hope to improve now that we have the new questions in play. And we also are running a data visualization site. It's something new that we've developed in the last 2 years that will allow us to use real-time data from the renewal site from the medical board to count the physicians. So if you put in how many physicians are in Clay County, then we know Dr. Kensel is there. It's real-time data from the renewal site directly. So we're working on it.
Mr. Chairman, can I ask one more follow-up? Along with that, are you allowed to ask the question, does that provider accept Medicaid?
Yes, that is one of our questions.
And are you allowed to ask, some say they accept Medicaid, but some say they're not accepting new patients in Medicaid. Is there a distinction?
I think that question is there. Yes, we also ask clinical practice now. Are you in clinical practice or administrative practice? So we try to drill down and actually find out what these physicians are doing.
Good, thank you.
And we're also starting to work with the nursing board, so we'll be capturing the nursing data. We just got their data set, because as of now, there's no data for nursing, but we have started working with the nursing board and made an agreement with them to capture their data as well.
Okay, we're running up tight on time, so we've got time for one or two more questions. Chairman Watson.
Thank you, Mr. Chairman. Thank you, Director, for being here. I kind of just want to echo the same things that the other chairmen have said. It is a little discouraging to see how our rural areas are being impacted. Our public and private institutions have done a great job at trying to get in the rural areas and fix a lot of those problems. But more specifically, I noticed that the PCOM cut. I know it's down in my district, and they're a brick and mortar facility in South Georgia, and we always hear that if these students go to school, where they go to school and where they do the residency, they stay there. And I hate to see that in there, but I hope you and your folks will work with us to continue to try to help them out in what they're doing down there. And then I also know that the Georgia South residency program is trying to kick off a rural psychiatric residency down there, and they've already got some federal funds, and I hope we can work to help them get that off the ground, because we have such a great need for mental health, especially in rural Georgia. So Thank you all for what you do.
Representative Hughley.
Thank you, Mr. Chairman. Seems like the chairman have already covered what I wanted to say. I just want to echo them that this is very difficult for us as we try to attack maternal mortality and the other major health issues that we have in our state, and we know that we don't have the medical professionals across our state to do that. So this seems counter to what we've been trying to do, and of course I appreciate the work that you do.
Thank you. We appreciate it. It was very difficult for the board to make the decisions for some of these cuts that we had to cut.
Representative Hawkins.
Thank you, Mr. Chairman. I just want to echo what I've heard some of the other chairmen say, and that is, I'm troubled by the reduction of loan repayment and the liability. For years, I've been an adjunct professor down at MCG and work with young folks coming through the office, and I hear about their concern about their mounting debt. And they're making decisions on where they're going to practice throughout that educational period. And years ago, we had the loan repayment for physicians and dentists. And then when times got tough, we cut them out for the dentists totally and cut back on physicians. Now we're doing the same thing again after we reinstated it. You know, we're going to create a situation where students are not going to be able to make those decisions any longer. And this really hurts our move back into the rural areas with these folks. This is a big thing to them to know that they can go back home and practice and not have those debts on top of the situation of maybe not having a full practice for many years. So I know you do a good job, and I know your department's struggling through all this. And this morning I've heard that, you know, over and over again, well, we're saving money on money we haven't spent. Well, that sounds pretty logical to me, but you're not in that situation. So maybe we can help you on our side too, okay? Thanks.
Okay, we've got time for one last question. Representative Bruce, way in the back.
Thank you. I'm over here. Have the schools already been notified of these cuts or potential cuts?
Yes, sir. When we were voting on the potential cuts, we had an open meeting. It was discussed in the meeting, and we've asked for impact statements to provide to Office of Planning and Budget regarding these cuts from the schools and all of the programs.
Okay. And then secondly, is anyone looking at the cost of these cuts in terms of, 3-4 years down the road, if we don't have the right number of people in place to provide these services, people getting sick and then having to go to alternative ways to get treatment and care, there's a cost on the other end of this too. Is anyone looking at that?
Well, the board could collaborate with Department of Public Health and Community Health on the impact of our budget cuts. We have not, but we're willing to talk to Commissioner Berry and Commissioner Toomey regarding that. And
I think we're at a particular time in which we have the majority of the physicians 55 and older. So that means that the number of retirees is going to increase very quickly by a large number, and we're just playing catch up to raise that. It doesn't seem that we're going to get caught up. So I think starting to think with other healthcare workers and see how, thinking outside the box, how are we going to supply? The truth is we're not going to supply enough physicians or produce enough physicians to meet the demand. We're not going to be able to do that, so we need to do it in some other ways.
Okay, last question. Given all of the possibilities of things happening, emergencies, just like you see what's going on overseas now, with the different diseases that are coming in. I mean, new stuff every day. Do we have a backup plan to be able to meet unexpected medical crises that seem to be popping up all over the place now?
So if I understand your question correctly, I would say that maybe an example could be the new threat of the new coronavirus from China.
Yes.
Are we prepared? I think that collaborating with our Department of Public Health and the CDC, we try to do the best we can. As of yesterday, I know that there were several alerts sent out in a massive blast that we received as healthcare workers, and wherever we were located in the state, as to what it is, what the plans could be, what do we need to do when we suspect. So I think that we are as prepared as we can be, and I'll leave it like that.
Well, Director Hughes and Doc, thank y'all for being with us. I'm sorry to everyone that we are out of time in order to stay on our schedule. But again, thank y'all for being with us. Thank you for what you do.
you.
And we look forward to working with you further. I noticed a glare in the back of the room just a little bit ago, and I realized it was Frank Berry's bald head shining back there. So, Commissioner Berry.
Can't beat that introduction.
You can sit there, Kelly. I'll stand back here.
Right.
Okay, that's great.
Well, Commissioner, good morning. Welcome. Thank you for being with us.
Good morning.
And I'll just go on and say from the outset, I appreciate the job you do as well. I'd mentioned to Director Rollins a little while ago, DFACS. He's got one of the jobs that I just don't know that I would want to take on in state government, and you've got one of the others. So that said, we appreciate what you do, and the podium is yours.
Thank you very much. You know, you mentioned DFACS, and I agree. I think Tom's got a tremendous job on his hands. We wouldn't be able to do what we do without our team, and I want to recognize the team at the department before we even get started. But Chairman Hill, Chairman England, I have been fortunate for this is my 8th budget presentation to you all, to be able to work with an incredible group of people at the General Assembly. I've had Chair Dempsey, Chair Unterman when I first started, and want to certainly recognize their support and leadership. Chair Parrish and Dr. Burke have been incredible to work with, and I'm grateful for your support throughout the year. We spend a lot of time talking and trying to figure things out throughout. Also, wanted to take a minute, I just don't think we do this enough, to thank the people who work year-round on the budget process. And Martha has been a huge supporter for well over 20 years. And so, Martha, wanted to certainly thank you for all of that. Tara, Elton, Melody, who is the conscious of kind of pushing everybody in a lot of ways. Kelly, Farr, a new member of the OPB team, Cody Whitlock, has been fantastic to work with, and our analyst, Hayden Huggins. So I say that because, I just don't think that we say thank you enough to those team members who work with us. We are that attractive agency that everybody loves. We are the regulatory compliance and finance agency. And I say that because there are times where we have to say no. But we're working on trying to become the department that says yes more often. And that has been a big push for us for the past year. Our ultimate goal is shaping the future of a healthy Georgia by improving access and ensuring quality to strengthen the communities we serve. Our agency oversees the Division of Medical Assistance Plans, State Health Benefit Plan, 2 finance plans, Healthcare Facility Regulation, so we're a regulatory body, State Office of Rural Health, and Health Planning, CON. 66,112 Georgia Medicaid births in 2019, 2.1 million covered lives on Medicaid, 665,000 SHBP members in fiscal year 19. And then we started the Rural Health Innovation Center down in Mercer to really help us get a better understanding through your leadership of what's going on in rural Georgia as it relates to health care, and they've done an incredible job already in year 1. And then we oversee and regulate 24,000 healthcare facilities across the state. As we prepare for our healthcare environment of the future, we recognize that we need to be prepared in some different ways than we have been in the past. Information technology infrastructure has to be improved. We did a Medicaid reorganization under Blake Fullenwider's leadership. We developed a new office called Continuous Program Improvement so that we could remove administrative barriers to both families that are seeking care and providers who want to become Medicaid providers. And we're doing a much better job than we have in the past with healthcare analytics and reporting so that we're able to give you good, clean information when you need it. And finally, the overhaul last year from the Certificate of Need legislation that was passed. And then the transparency legislation as well. Some of the accomplishments that we had that were pushed by Governor Kemp's initiative to streamline government: converting paper processes to electronic processes, creating centralized incident reporting systems with follow-up tracking mechanisms, creating centralized user-friendly end-user portal to streamline provider enrollment, and removing restrictive requirements such as an annual or provisional licensure for home health, private home care, and hospice that takes time away from patient care. Of course, last year we passed the Patients First Act, or you all passed the Patients First Act, and we implemented, again under Blake's leadership from the department in partnership with Ryan Loke from the governor's office and with the governor's, many other governor's staff. The governor signed SB 106 on March 27th, 2019. That waiver has been submitted, and it's been received as a certificate of completeness of the application, which is a formal term, from CMS on January 6th of 2020. I did want to just revisit before I turn it over to Lisa to get into the numbers. We certainly recognize that being a finance with SHBP and Medicaid insurance program, along with the regulatory and compliance aspects, that we can do better. For a number of years, our position as directed was to not mess with CON. And the other piece was to not discuss anything regarding waivers or anything that touched Medicaid, and to keep the SHBP package rates pretty steady and the benefit package pretty robust. Over the last year, the department has turned that battleship, and we are now looking at waivers for Medicaid. We have now implemented several of the CON required legislative priorities. And of course, we're looking at SHBP and how we can make certain that members who are covered through that program are receiving absolutely incredible health care, but that we're keeping an eye on cost. So it's an honor to work with the department and for you all. It's an honor to work for Governor Kemp and his team. We'll turn it over. Our budget was 97% of our budget goes towards benefits, and so the cuts that we implemented did not impact benefit programs. So you'll hear that from Lisa. So Lisa, I'll turn it over to you for the budget, and then we'll be up for as long as we need to answer questions. Thank you very much.
Good morning. I'll be going over the Department of Community Health amended fiscal year and fiscal year 2020, amended fiscal year 2020 and fiscal year 2021 budget. I'm going to present it on a side-by-side, a comparison, because many of the items are similar in nature that carry overs into the following year. And I'll do this programmatically related to the Department of Community Health. The first program is the Departmental Administration and Program Support. And the first of those reductions is $2,544,383 reduction in the amended year. And that same reduction will also be in fiscal year 2021 of $3,711,633. And that's the transition right from the start Medicaid to the Department of Human Services. And those activities have already been transferred over, and they were transferred over on November the 1st of 2019. The second reduction for Department of Administration is to reduce funds for personal service to reflect projected expenditures. That's $201,343 in the amended year. $476,614 in the base year. And those reductions are managing our vacancies as it relates to the reduction in personal services and some temporary positions that were eliminated. The next reduction is to reduce funds for contractual service to reflect projected expenditures. And in the amended year, that was $703,656, $1,385,657 in the base year. And those contractual reductions were contracts related to our hourly contracts that we can better manage, and we can manage the hours related to those, and that's resulted in those reductions. The workload adjustment that you see, those are the statewide changes that are actually in every agency's budget by the Governor's Office of Planning and Budget. And those particular changes, $4,901 in the amended year, $39,915 reduction in the base year. And those are changes such as administrative personal liability insurance that goes through DOAS or teacher's retirement system, those statewide changes that impact all agencies. The next is a transfer, and that you only see that in the base year, which is fiscal year 2021, of $3,730,520 from low-income Medicaid to Department of Administration. And that transfer is really for our contract related to our system, where there's always changes related to whether there's a nursing home rate. We have to always get our contracted vendor that manage our system to do certain changes in the system, and it's by per member per month cost as it related to that contract, and this is just the escalation cost as it related to that, and we transferred that from LIM to departmental admin. The next is an increase in funds for the reduction in the enhanced federal medical assistance percentage of $3,354,747 in the base year. And this is related to a change on the federal level with the reimbursement percentage going from 88.61% to 76.92%. And this will basically cover all the changes that was in our departmental administration. And on our next slide, we're going to present the benefits program, which is age, blind, and disabled, low-income Medicaid, and the Peach Care program. And you see some of the changes reflected in the amended year and the base year, but more in the base year than the amended year. Our benefits growth across the Medicaid benefits program is a reduction of $38,583,070 in the amended year, and $89,578,629 add in the base year. For the amended year, I would like to state that that's a growth in ABD, age, blind, and disabled, of $65,267,880, and what you see as an overall reduction really comes from the LIM program, low-income Medicaid, and it's a reduction of $109,568,690, and Peach Care has a growth number of $5,717,740 add. The next item is Medicare Part B, and we usually present this to the committee every year, and these are federal mandates that come down regarding the dual eligibles. And the Medicare Part B is the Part B related to premiums for the dual eligibles in the Medicaid program, and it's an increase of $6,780,737 for the amended year, and $5,229,000 for the base year. The next is Medicare Part D. That's also a federal mandate as it relates to the prescription for those who are dual eligible for Medicaid and Medicare. And it's an increase of $3,936,297 for the amended year, $5,229,225 for the base year. For the remaining adds or reductions, it would be for the base year only, and that's a federal medical assistance percentage reduction as it relates to fiscal year 2021, and there will be an increase in that particular item for the benefits program of $16,435,322 for the base year. For health insurer fee, that'll also be an add as it relates to the health insurer fee. This is the amount that represents the reimbursement to CMOs for the Medicaid portion of the health insurer fee, and that's an add of $38,876,700 for the base year. The graduate medical education and inpatient medical education line item is an add for $2,935,770, and that is actually an initiative to expand the number of hospitals that have a graduate medical education program, and two of the components for the graduate medical education is the direct and indirect medical education as it relates to that, and that's an add of $2,935,770. An enhanced federal medical assistance percentages for the Peach Care program is an increase of $59,982,382, and that's an increase in the percentage as it relates to the enhanced rate in Peach Care. The next is a transfer, and I mentioned this in the Departmental Administration program, and this is just a reflection of the transfer out of low-income Medicaid to Departmental Administration for that contractual piece with our vendor that manages our systems. For the next item in our budget will be some of the additional programs within our budget. It's Indigent Care Trust Fund, and it's an add of $23 million in the amended year, and this is the portion that of the disproportionate share hospitals represented by private hospitals, where you have to put up a match as it relates to that. Public can have an intergovernmental transfer, but for the private hospitals, they have to have a state general funds appropriation, and this is the appropriation of the $23 million. Next program is Georgia Board of Dentistry and Pharmacy. It's a reduction of their projected expenditure in the amended year of $63,892 in the amended year, and a reduction of $97,338 in the base year. And the workload adjustments you see there of $282 in the amended and $10,760 in the base year are the same reflections in the Department of Administration budget of self-insurance programs, GTA administrative costs as it relate to those statewide changes. The next program is Healthcare Access and Improvement. It's a reduction of one-time funds for the Rural Health Systems Innovation Center of $463,000 in the amended year and the base year. And you also see the workload adjustments in Healthcare Access and Improvement of $92 in the amended year, $4,857 in the base year. Healthcare facility regulations, add there are also the statewide changes that you see throughout each agency in our agency budget of $2,725 in the amended year and $21,938 in the base year. And that actually concludes all of our budget recommendations, but we usually give the committee an overview of state health benefits in terms of a financial status, and that's the next slide that's up. For fiscal year 2019, those are the actual costs and expenditures related to state health benefits. In 2020 and 2021, those are the projected out years. And as you can see, the revenue that came into the program for the actual close of 2019 was $3,854,233,186 against the expenditures of $3,369,425,229, which netted a surplus of $484,807,957. And you see that go throughout and projected the year. You see a deficit as it relates to 2020 and 2021, and those are operational deficits in terms of revenue expenditures coming into the program, but there are prior year reserves as it related to state health benefits to cover what those projected deficits are within the program. So that concludes the Department of Community Health's presentation of the budget, and we're open for any questions.
Okay. Thank you, Lisa. I want to stop real quick, and Commissioner, you pointed out some of you folks that do the day-to-day work, and, you know, a lot of times folks are in the coal mine digging, and we don't always get to see them. Lisa is certainly one of those. And Blake Blake Fullenwater, y'all, he may actually be one of the brightest minds as it relates to Medicaid in the United States of America, and his understanding of how that program works. And we're very fortunate to have him leading that division at DCH. And Blake, just wanted to give you a shout out, because I know a lot of times that one or the three of y'all are on the phone with me about an issue a lot of times, and we always figure out a way to make things happen, and occasionally get a phone call from a small rural hospital trying to make payroll at the end of the week, and we get on the phone with y'all and some others, and we seem to always figure out a way to make that happen so they can keep their doors open and providing health care for those citizens that they serve in their areas. We'll open the floor for questions now, and Senator Lucas.
Yes, Commissioner, if CMS approves 1115, 1132 waiver, comparatively speaking as to our match, right now, our match with state dollars with the feds is close to 9-1, isn't it? If we go to 100%, what will our match be then? 1-3, 1-4, 1-5?
Let us get you a number on that, and we'll follow up. Blake will do some research on that one, and we'll get back with you before the end of the day today.
Well, the reason I'm asking, what is our total amount of money that we put in from the state, and we got a match of 9-1? We're at 138% of the poverty level, and the waiver goes to 100%, which means that when you look at it, you also got to pay for insurance, and you're talking about folks who have problems already. So if you don't make the insurance payment for 3 months, then you are banned from the system. So my question is, how much money are we talking about from the state's perspective on the match when you go to the waiver? Is it 215? Is it $213 million? What is it?
We'll look. So go ahead, Lisa.
No, we'll have to get back with you on that one as it relates to the 1115 and what it will be based on the federal poverty level percentage, whether it's 100% or 138. We'll be able to get back to you today regarding what that state appropriated match would be.
Chairman Ron Stevens.
Thank you, Mr. Chairman. In regards to your Medicare Part D clawback that you put there, does that money go back to the taxpayers or to directly back to the pharmacy benefit managers?
The Part D that you see in our appropriation, that's money to actually pay for the prescriptions of the beneficiaries in the Medicaid program. So that pays for the Part D premiums as it relates to their prescriptions.
Do you participate at all in the DIR fees that are causing a real problem for pharmacies across the state, that are huge clawbacks directly, as my understanding, directly to the PBMs and not back to the taxpayers? Can you expound a little?
You're referencing the rebates that actually goes back to the PBMs. Is that what you're referencing?
No. I'll get with you offline.
Okay.
Okay. Chair Lady Taylor.
Thank you, Mr. Chairman. We've listened to a lot of the budget information. Healthcare is very vital in rural Georgia particularly, and I have seen the reduced one-time funding for Rural Health Systems Innovation Center, $463. How did you come to do away with that? Again, we feel like we're making some progress. Why is that particular item? Where did you get that number from?
That was part of their overall grant. We're looking at that right now, and we'll be able to have a better answer for you in the next couple of days on that. There's ongoing discussion about that.
Okay, because that's vital.
Yes.
We need. Thank you.
Yes, thank you.
Okay. Senator Walker.
Thank you, Mr. Chairman. Commissioner, I first want to commend you on your department and all the hard work you all did on the 1115 and 1332 waiver applications. Very, very excited about that and what that's going to do for hardworking Georgians. I am curious on the FMAP slide. Our FMAP went down because our economy's doing better, so that's good. But of course, it costs us more money in the Medicaid program. Aren't we getting about is it 60-40 share from the federal government on Medicaid currently? Is that correct?
Yeah, Lisa,
can you go back to the FMAP slide?
It's approximately 67-33.
Okay. So my question is on the FY 2021 figures for your budget for Medicaid, is that anticipating a 90% share from the, or is that anticipating the approval of the waivers and a 90% federal contribution, or is that using the same FMAP figure?
That FMAP increase that we would present it today, it's our regular traditional Medicaid that we're currently operating. That does not include the waiver.
So that's a more conservative approach. That's good. If I don't, Mr. Chairman, can I follow up with another question? The disproportionate share for hospitals, there wasn't a figure in the 2021 column. Why is that?
We usually do it in the amended and not in the base year budget because it goes up and down, and at a particular point in time, we don't know what that particular number would be. And even with this number, it was based on an estimate because those payments usually go out at the end of the state fiscal year once we get all information to calculate the dish payment from all hospitals.
But it's not going to be zero. It seems like you would need to put a number in there to me. But anyway, thank you.
No, it will not be zero in 2021. We will ask for that in amended year 2021.
Okay, thank you.
Mm-hmm.
Okay, Representative Stovall.
Thank you, Mr. Chairman, and to Commissioner Berry. I brought up an issue when session started about charter schools not being able, that have less than 50 employees, not being able to access the state health benefit plan. And I do want to thank your department for working diligently to rectify that problem. But I want to know, how old is the interface system that you all are currently using? Because I know when they got ready to use the flexibility plan with DOAS, they didn't have any problems with them being less than 50 employees.
So the system is about 10 years old, but it's renewed pretty regularly. It's updated pretty regularly. And I know the school that you were advocating for, we recently were able to get enrolled. It's a challenge with a small school. They were the only ones that we had a struggle with the interface. So we're still looking at why that happened. So I don't really have a better answer than that, other than it was a unique situation that occurred. They were the only ones that there was a delay, and we'll continue to work with them to make certain that their team members get the SHB coverage that they need.
Mr. Chairman, can I follow up? Actually, when I talked with the State Commission as well and Georgia Charter School Association, there were other charter schools that had that problem. They most of the time they end up going outside of the state health benefit plan, and I think we have regulations that say if they go out, they can't come back in. They're not going to be eligible for the discount. So they were trying to work around it, but it's been difficult for them. It's just this particular situation. I was able to contact your office, so I'm definitely look forward to working with you all on trying to make it easier for those charter schools that have less than 50 employees.
Great.
Thank you.
Chairman Knight.
Thank you, Mr. Chairman.
Wait, you're breaking up. I can't hear you.
Yeah. Commissioner, no, I first of all, I appreciate it. You know, I would agree with Terry. You probably have the hardest job as far as any agency this year that I could imagine regarding the issues and you know, around healthcare. So I say kindly and sincerely, I appreciate what you're doing and the work that's put in your department. And I'll preface this by saying, again, we've had good talks. This General Assembly is concerned, and our priority is health care. It is to make sure that the physicians and the patients, the best health care possible. Let's put those two together to make sure that we're using Georgia state resources wisely, and we continue to put patients and providers together. With that being said, I know you and I have had good conversations, but one of the big issues that we've talked about is the study, actuarial study that was in West Virginia, and there was an actuarial study from Kentucky regarding a carve-out of prescription drugs out of managed care. Those studies in West Virginia and in Kentucky both showed considerable savings. I believe the one in West Virginia was $50 million, while also making sure that independent pharmacists were being paid a fair dispensing fee. You and I have talked, several chairmen have requested the actuarial study all the way back to November. So I just want to make sure that as we go forward that y'all are in agreement that if we put this money in this budget, seeing that y'all could not find it before these cuts, that $150,000 or so actuarial study that could yield as much as 50 to even more, $100 million in savings to the state, plus better access and health care, that y'all are in agreement with that. That is something that the department agrees should be done.
Yeah, and thank you for your time last week, and I know we spent a significant amount of time talking about that. The department's position has not changed. If the money were to be added to the budget, we would absolutely embrace doing the study.
Well, I appreciate it. I sure wish we could have found $150,000 2 months ago, because we would have had some data to go on now as we get into the budget session. But I appreciate that going forward. The second thing is we had a discussion regarding major legislation that came out of this General Assembly almost unanimously last year, signed by the governor, and that was the anti-steering bills. It is my understanding from some of the open records that DCH has taken a position, I think it was the state health benefit plan was not subject to anti-steering. Is that, have y'all talked about that? I know we briefly discussed it. And are you aware of any other plans that, in regards to the state, where they believe that they are not subject to the laws passed by the General Assembly?
Yeah, so again, thank you for bringing that up last week. And I think, again, what we did after that meeting was we have legal looking and reviewing that, and we'll get back with you on where and why the department took the stance that it did. So we'll have ongoing discussions with you about that. Bringing that up last week during that hour-plus meeting was very helpful to hear how you all looked at that, and our legal team's reviewing that now.
Senator Jordan.
Thank you, Mr. Chairman. Commissioner, with respect to the 1115 waiver, DCH is going to be tasked with administering the work requirement that is part of that waiver. Has your department made any kind of analysis in terms of the impact or the cost with respect to what is it going to cost extra to the agency in order to administer that requirement?
We're in the process of doing that review now. So that work is ongoing. That's kind of the second phase after submission, is now looking at what it's going to take to implement. So we're working on those figures with our partners, and we'll be able to have a better answer for you over the next, several weeks, several weeks.
Any estimates?
I don't think we have an estimate yet that I'm aware of. Not an estimate yet.
Representative Hughley.
Thank you, Mr. Chairman. Mr. Commissioner, thank you for the work that your department does. Can you just, we've kind of talked about the Medicaid waiver a little bit. Can you just bring us up to date on where we are and how the public can make comment on where we are.
So public comment from the state is closed right now. At the federal level, it's open, correct? I'm double checking with our expert over here. So the application was submitted to CMS, and CMS has, is it 60 days, 30? Through February 7th for people to make comments at the federal level.
Well, I guess we got to hear from the car dealer today. Senator Miller.
Thank you, Mr. Chairman. I want to recognize and say how much I appreciate Commissioner Berry and Blake and others in the department that have worked through incredibly difficult circumstances over the past year or so, and then going into the new budget process, working through difficult circumstances as well. The services that you provide for our constituents are invaluable, and as my friend from the coast mentioned a moment or two ago, that a lot of these things have to pass the Walmart test. You know, when I walk through Walmart, does it do those people good? And I think that was a great analogy, a great description of a lot of the work that you're doing is doing those people good. Thank you very, very much for what you're doing.
Thank you. Thank you.
Well, Commissioner, believe it or not, that wraps up all the questions we had on the board here. And we appreciate y'all being with us.
Thank you.
Appreciate the time, and again, thank you for the job that you do and that your team does. We certainly appreciate it.
Thank you very much. Thank you all.
Ladies and gentlemen, if you would please be as quiet as you can as you're easing out. We're actually going to be able to pick up a few minutes here. Insurance Commissioner King is already here with us, and so we're going to bring him on up just a little bit early.
How are you? Good. Okay, it's here. I didn't know if I had to plug in and play or whatnot. I'm going to just use the keyboard and click it. Just use this. No, he has a presentation. Well, let me see. Commissioner, you want this on the podium?
No, I got it right here.
Everybody, please quiet down. Please quiet down. I know you're all excited. Thank y'all. Commissioner King, thank you for being with us.
Thank you,
and congratulations on your new role. I know we're several months into it, but this is the first opportunity you've had to present to us, and we look forward to hearing from you. And at this point, the podium is yours.
Thank you very much, Commissioner, Chairman, Mr. Chairman. I guess the excitement must be because of the fresh victim that we have before y'all. Thank you all very much, Chairman England, Chairman Hill, and committee members. Thank you very much for allowing me to come and make some remarks and talk about the strategy and the impacts on our budget. As you can see, I'm going to outline some of the budget priorities for Insurance and Safety Fire Commissioner's Office. Since my appointment in July, our team has taken a deep dive into all aspects of our agency to find what works, what doesn't, and what improvements we need to make to ensure that we're the most approachable, responsive, and efficient agency in our state government. We've made some personnel changes, including removing positions that were not serving the people of our state and combining several roles and responsibilities. We reorganized the entire programs to make better use of resources and correct long-standing inefficiencies. As we've empowered our best employees to make better use of our resources and look at ways to how do we improve our process. Thanks to this work, we've been able to meet the governor's requested 4% reduction without cutting any essential services related we serve the people of our state. This morning, I'm going to briefly walk through some of these changes and some of these high-level changes that we make to improve our agency's budget. I'm thankful for the opportunity to discuss these proposals and and I hope my remarks today will demonstrate that we really put a lot of thought process into how do we do our duty to our state. I know this is only the initial part of our how do we reorganize this agency, and I look forward to your comments and your questions. Next slide, please. I want to begin with our FY 2020 budget changes, which you can find on page 223 of the governor's budget document. Enforcement and industrial loan reductions reflect vacant positions that remain unfilled as part of the reorganization and streamlining of our agency. We combined the positions of General Counsel, Director of Administrative Procedures, and Director of Industrial Loan into one position, having significant savings there. And the additional cost-saving examples, we distributed a records management throughout the agency as part of our reorganization instead of having a standalone director. If we go to the next slide. We are working on our legislative change that will highlight further in my presentation that would allow us to continue meeting our obligations with these 6 vacant positions. The $100,000 in new vehicles will save our agency money in the long run. We currently have a number of employees driving their personal vehicles and are traveling long distances, which is a lot more expensive than providing a state vehicle and getting some efficiencies there. There's a one-time $100,000 IT infusion that will allow us to begin accepting electronic submissions from our consumers for review. We currently have to have our consumers print documents for review, send them to us in the mail, and then we have to scan them into a system for plans review. This delays, plan review, and we get in the way of local and authorities to try to build projects because of the delay. And by pushing all these plans into a digital format, we can do it a lot more efficiently. Next slide, please. While we're cutting over $250,000 with reorganizational changes, we requested one-time funds of $700,000 to pay for significant infrastructure upgrades, one-time dollars, along with a new system that will allow us to capture more state funds annually. I will go into more detail with these changes in other slides, sir. Next slide, please. Surplus lines is any type of insurance that's not considered admitted. Admitted lines are your traditional car, health, property, and casualty insurance. Surplus lines can include anything from a professional athlete insuring his arm before an NFL draft to a high-risk policy for a multinational oil company. Florida has developed a software that makes it easier for these insurers to report their policies for premium tax collection. We estimate that we can bring anything from $500,000 to $5 million in additional general funds to our state by adopting this system. The system will also allow companies to file online, which will eliminate the current paper submission process that is burdensome to both us and the industry. We will also help ensure compliance by requiring companies to report this business line while already making the premium tax calculations. 11 states currently use this system and is showing some significant promise. Next slide, please. Our agency is the second largest revenue generating agency in the state with $1.6 billion in annual revenues. Yet we are collecting this money on antiquated homegrown applications and a website that was developed in the early 2000s. We do not have a way to collect electronic payments for a number of items, which again is both a burden to both business and to the agency. We have programs that were built inside our agency built by employees that were no longer currently employed with our state. We do not currently have Wi-Fi in our agency, and our network infrastructure is just not adequate for today's world. This is a one-time infusion of funds that will allow us to take significant steps and to bring our department into the 21st century and protect taxpayers' funds and information. Next slide, please. From moving from a vintage server system to the cloud, we will be able to save significant money on office space and equipment as we protect our data in the event of accident or equipment failure. And I will outline some more details on this plan. Next slide, please. I will now move into the 2021 budget changes, which you can find on page 224 of the governor's budget document. You will see through 2021 budget changes that we are considering from consolidating our agency from 3 floors in the Floyd building to 2 floors. This move will save our agency over $250,000 annually, which will be divided among a number of other programs. We have combined a number of positions and realigned duties to improve our efficiency and save state funds. Next slide, please. As we are looking for ways to save money, we've learned that our agency is required to inspect every elevator in our state twice a year. Nobody can really explain to me why we inspect every elevator twice a year in our state. It is not based on failure data or safety. We just do it. And so I'm asking for help from y'all to help us, look at that law and try to modify it. By currently, a majority of the states around us inspect our elevators once a year. Some of them even extended to every 18 months. By changing the law to an annual inspection model, we can move from our current 30% coverage of all elevators twice a year with our current manpower by moving it to once a year, we can reach now 95% compliance with current staffing levels without adding additional employees. The alternative is if we continue this, I would have to come and ask for 20 additional inspectors just to keep up with the demand. And it's not based on data that the safety or failure rates. So it really does not make a lot of sense for us to continue the current program. Next slide, please. We are realigning just over $200,000 from insurance regulation to safety fire in order to fund the new deputy fire marshal position, along with the additional operating expenses that entails. This new position is part of our plan to restructure safety fire just inside our agency to better serve local governments and builders and contractors who depend on us for code updates and plan approvals, as well as over 500 fire departments across our state that look for us for support. We just made a significant code update to our fire codes that has not been made in over 10 years. So we just published that recently. We are now on I will now reference page 225 of the governor's budget document. Special fund is funded by Georgia insurance industry. By making it a separate program, we are increasing transparency around how we use these funds. We've made revamping of this program a top priority, including hiring a new director who's working to ensure that we have professional, ethical investigators in these key roles. As you can see, insurance fraud impacts everyone in Georgia in the form of higher premiums. This is why the industry supports an increase in funding. In fact, they send us the majority of the tips that we investigate, and because it benefits the industry as well. Next slide, please. As you can see in these charts, it demonstrates how the increase in funds will help our current caseloads in bringing new investigators. The optimal caseload per investigator is 20 cases per investigator, but our current investigators have over 60 cases assigned to each. While our current caseload won't decrease dramatically with this new funding, we will significantly cut on the number of unassigned cases. We currently have over 5,000 tips coming from the industry every month outlining fraud, potential fraud, and many of those go uninvestigated. These funds will allow us to hire 13 additional employees that we will assign out in the region. I feel that Metro Atlanta has got adequate coverage, but we need to get some additional coverage across the state, because those sheriffs and police chiefs are having a tough time investigating very complicated crime. Next slide, please. Again, our major savings is combining our agency from 3 floors in the Floyd building to 2 floors. Moving is providing a significant cost savings, and we previously discussed that we are transferring funds to the safety, fire, and special funds. Next slide, please. Thank you again for the opportunity to present to you today. And I thank you all for the hard work you all are doing. As you can see, we have a lot going on in our agency. We want to be the most approachable, responsible, and efficient agency in our state. And we believe the governor's recommended budget will help us get there. I will now ask for any questions or comments, Mr. Chairman, that the audience may have of me.
All righty. First one up, Chair Lady Taylor.
Thank you, Mr. Chairman. Just a quick question about the transfer to the banks and banking finance. How did this come about to transfer the industrial loans, and why? I believe we had legislation a few years ago and it didn't pass.
Ma'am, that was a recommendation from Office of Planning and Budget, and it made sense. It's aligned. The mission statement of the banking and finance aligns with this move. It is just a recommended, continued recommended. It makes sense. We do it well, but it aligns better with their mission statement than it does with ours.
If I could follow up. The other question has to do with insurance agents and the agencies. Have you seen a growth in the number of agents in the department as far as people out, not your employees, but those in the industry? And will any of these reductions be reflected in the services that they provide?
None at all, ma'am. We are getting our savings through increased efficiencies. Our systems are so, that's why the one-time money in our IT is getting us that be able to, we see no reduction in the service level. We're relooking at our contracts that we have with our back office vendors to get some efficiencies. They've always been in those contracts, but we really have not, nobody has gone through the books with a fresh set of eyes to really look at how we can get those efficiencies there.
Thank you.
Thank you.
Chairman Watson.
Thank you, Mr. Chairman. Chair Lady Taylor kind of touched on it in reference to the industrial loan move. I know in the past we've had legislation that tried to do that, and I didn't know if you knew if there'd be a piece of legislation dropped along or very soon to go along with the budget to make that move official.
I'm not aware of but I know that the idea has been discussed with us, and we have no opposition to it. It makes sense to move it.
Okay, good deal. Well, thank you for the job you're doing, and you've been great to work with so far.
Thank
so
you very
appreciate
much.
what you're doing over there.
Chairman Knight.
Thank you, Mr. Chairman. Commissioner, I've heard nothing but great things. You run a tight ship, is what I'm hearing, so I really appreciate that. My question goes back to the transfer of the $200-something thousand from the, I guess, insurance regulation over to, I guess, the fire safety. My question is in light of in the past couple of years, your insurance, you as the commissioner and your department or agency has been tasked with more oversight, especially in the realm of the healthcare issues, PBMs, and I guess my concern is as we've given you more oversight in that, will these transfers from insurance regulation to maybe fire safety, in light of more oversight that you're asking from you, is that going to hamper your ability to provide adequate oversight and regulation through the legislation that has been passed in the last couple of years, and maybe in current years?
Thank you very much for the question, and that's specifically why we are moving, because we want to make sure that we are not encumbering the current regulators who have these additions. We're working very closely with Commissioner Berry, and how do we manage this process. So I'm trying to unencumber them from current additional duties that they have, so we clearly align duties and responsibilities with the true specialists. So I'm moving this. One of the things that I'm trying to address is a complaint and obviously a lot of concern that our codes have not been updated in over 10 years. So to address that, I need to hire somebody that will focus on keeping Georgia fire codes, current, because people are building construction constantly, and if they're working with outdated codes, it will hurt their bottom line if they're having to make last-minute changes. So I want to focus on that while we take the responsibilities and duties from folks that are having to do both.
And I appreciate, and again, that may be a follow-up that if you could maybe, we could have a conversation at length, maybe a little perspective and history that may give you a better perspective of some of those oversight.
That would be very helpful, sir.
Thank you.
I would appreciate that.
Well, Commissioner, that appears that you've put out all the fires in here today.
Well done.
I'm just seeing if y'all still awake. We do appreciate you being with us, and thank you for the job you're doing as well, and look forward to working with you going forward.
Thank you, Mr. Chairman. I was used to having folks throw things at me as the chief of police in the city trying to work on a budget, so this is a very nice change. I really appreciate the hospitality.
Just give it time. Just give it time.
Thank you, Mr. Chairman.
All right, ladies and gentlemen, we're managing to stay just a minute or two ahead of schedule, and that's a good thing. Next up is Commissioner Judy Fitzgerald with the Department of Behavioral Health and Developmental Disabilities. I'll just say another word there's about 3 jobs in state government that I just really wouldn't want to have to do myself, and this, you've already seen 2 of them, and this is the 3rd one. So Commissioner Fitzgerald, thank you for what you and your team do, and appreciate you being with us today, and the podium is yours.
Thank you very much. Thank you, Chairman England, Chairman Hill, members of the committee, and members of the Assembly. It's a privilege, actually, to be here today to present the budget for the Department of Behavioral Health and Developmental Disabilities. I know our time is short today, but our mission is critical. So I'm going to do the best I can to share with you where we stand for the budget this year and how we've approached the call for budget reductions this year. So I'll let Chris, my compadre, bring up our first slide.
And as soon as I find the right button, we'll be ready. Thank you.
Thanks for your patience. So, are you advance? Next one. There we go. This just tells you what I plan to talk about this morning. Give you a quick agency overview, just to remind you who we are, what we aim to do, and then tell you a little bit about the budget reductions, the approach that we took to making hard decisions, and then I'll show you specific detail program areas for the budget reduction, tell you about workload and other adjustments that we are proposing, and then looking ahead to fiscal year 21, and I'll leave you with some information about that. So, with that, let's proceed. Remind you a little bit about who DBHDD is and what we are charged with doing. As you can see here, and as many of you know, DBHDD is Georgia's public safety net for individuals with mental illness, substance use disorder, and intellectual and developmental disabilities. Our priority population are individuals who are uninsured, underinsured, and receiving Medicaid. In fiscal year 2019, DBHDD and its network provided services to over 212,000 unique individuals. And how do we do that? To be clear, we have a network of 5 state hospitals run by DBHDD employees and a network of over 700 community-based providers. we serve some of the most in-need individuals in our state. And I also want to acknowledge what many of you have reflected back to me, that this is a growing concern for individuals with these particular disabilities. We share this challenge with every other state in the nation across the lifespan and across the geography of our nation. Mental health, substance use disorders, and people with disabilities, intellectual and developmental disabilities are an increasing challenge for every state and therefore every state budget. So what I want to do next is show you 3 quick snapshots of the DBHDD budget. They really tell you a lot about who we are and what we do. First one, this is a snapshot of each of our program areas. I show you this one just to show you the breadth of areas of disability that we serve. Many of you have interest in a particular disability area. This shows you the outline of all of the areas of disability we serve and shows you the 2020 state appropriation in each of those areas. Next slide, second snapshot. Another way of looking at our same budget is this. This shows you current budget by category, and here we've divided to show you the state funds versus the federal funds. We've also divided between hospital and community. But another thing I want to draw your attention to here is the low administrative costs that the department bears. We're really proud of our lean budget. You can see there, you could calculate, our administration is 3% of the total budget here. Next snapshot, and this is one I hope looks familiar to a lot of you because I've been showing this to you year over year. This represents changes. Those first dots are 2010, takes you to current through 2019. The yellow line, it might not be that visible to you, are community-based services. The red line is hospital-based services. We have done exactly what we intended to do, which was to maintain safety and quality in our 5 state hospitals, and then also to increase what's available in the community. As all of you are well aware, this is what the state was required to do by virtue of the settlement agreement with the Department of Justice. I want to thank you all for your continued commitment to making that real and to show you what that looks like in how our budget is allocated. Okay, so now want to talk about the budget reductions. And first, just to acknowledge that it's a challenge for all of us to be in this environment. It's especially a challenge for a department that's as large as ours, and I'm going to say a little bit more about that, where we are heavily dependent. In that state and federal slide, you saw that our total budget is $1.4 billion. Our state funds are $1.2 billion. So we are heavily dependent on state funds, and so a reduction to our department is challenging, and especially we're a mission-driven workforce that has important work to do for people with disabilities and vulnerable individuals in the state. That said, we embrace the challenge, and we want to be as transparent as possible in sharing with you how we approached this work. All right, next slide. I'm going to spend a minute on this slide. What we tried to do was to capture the summary story of who DBHDD is and what we tried to do here. So it's a little bit of reminding you that blue dot that you see there quickly says the same thing that we tried to show you. We have a broad scope of services and a broad array of people with disabilities that we're trying to serve. We have our 5 state hospitals. We have over 700 community-based providers in our network. We also have individuals who are court mandated that we serve. They're individuals who have been accused of a crime and have a mental health or substance use issue, and they may be court mandated to services. Their entry into our service system and their exit from our service system is not within our control, but they are an important population of who we serve. So that's a simple statement of our broad scope of services. As I've mentioned, in that total budget, $38 million is our 3% of is our administrative costs for the totality of the department. We think that represents lean administration for a statewide agency serving such a large population. In the effort to make the reductions, DBHDD was given 2 exemptions. What was exempt from the DBHDD budget was the Medicaid match dollars and our tobacco settlement dollars. I'm going to show you all these dollars in a minute. but there's an important story to tell you about where that left us after we had those exemptions. We still had large reduction targets that we had to meet. And you see the numbers there. In fiscal year 20, it was 34 million. In fiscal year 21, 45 million. But I really want to make note of those two targets that we had to meet, and why you're going to see a phrase and a number, $13 million, a redirect of funds that we had to do to make important decisions around priority populations. So I'm going to tell you a little more about that. I want to assure you of a couple of things, though. First and foremost, as you see in the first bullet there, DBHDD embraced the call for efficiencies in government. We took a hard look at how we could streamline everything that we do, and that work will continue. But the second reality in the bullet there is, because of the unique characteristics of DBHDD, our dependence on state funds, the wide swath of people that we serve, it was not possible for us to take the cuts without a reduction of services to individuals in the state. So what we've done here, and the story I'm going to tell you as I show you the numbers, is to talk to you about how we took the reductions and we paired that with a redirection of funds in order to make sure that individuals that are currently being served in psychiatric crisis services, essentially, that we could preserve that capacity that exists in the state right now. So now let me tell you a little bit more about how that looks in the numbers. Okay, so I told you about the big story here, which is our state fund appropriation, and I'll use round numbers in the conversation, is $1.2 billion. The exemptions that I mentioned, there were two. Medicaid state match, that was approximately a $285 million exemption, and the tobacco settlement funds was approximately $10 million exemptions. Where that takes us is, then it gives our state budget, the state funds after the exemptions, puts us at $935 million. So that's still a large budget from which to extract cuts. And now you'll hear me say again the numbers that were our budget targets for fiscal year 20, for amended 20, and for 21, $34 million and $45 million. Next slide, thank you. Okay, so how did we go about this? And it's really important. In a large department with a large workforce, we have almost 5,000 team members that work for us, and really having the team understand how the department is going to approach these cuts. So being clear internally, and we want to be that clear externally. So, and I have a really seasoned, experienced team, some of whom are here with me, many of whom are working in programs all around the state and in our hospitals. But as I said, we embraced the call for efficiency, and we set forth some principles and values for making the cuts. The very first and most important one is that we wanted to minimize the impact on individuals currently being served. There is great need and great demand in our state and all around the country, but we wanted to minimize the impact of budget cuts on individuals currently in service. The second thing, also vital to the work we do, is to maintain hospital quality and safety across our 5 state hospitals. Third, we also wanted to minimize the impact of cuts on full-time agency staff. And then finally, really be thoughtful and to make strategic cuts that would achieve lasting savings and really have the least possible impact on vulnerable citizens. So those were the values we embraced. And now I'm going to tell you a little bit about what the actual cuts are and how we, because our budget is large and complex, I've broken them into 4 categories for simplification purposes. They're not exact, but they help us to communicate to you what it is we were trying to do. Category 1 was that first charge that we had. How do we do reductions in efficiencies and find efficiencies in administration? Category 2 is reduction to services that had not yet been implemented. Category 3 is reduction to underutilized services or programs or contracts. And then Category 4 was reductions that would be applied to our 5 state hospitals. They're painful cuts, but we want to simplify the way we communicate them to you. Okay, so this very first category, what I call Category 1, administrative cuts. Where do we find efficiencies and ways we can streamline what we're doing? You see some bullets there about the areas that we searched. Probably wouldn't be a surprise to you. but I do want to remind you what you've already heard. The administration of DBHDD's 3% is the cost of administration of our very large budget. So when we took the cuts in those areas, what it yielded, as you can see in amended 20, is 1.5 million, and what it yielded in 2021 was 2.3 million. You remember our targets are 34 and 45, so we still had a long way to go in terms of our cut. Next slide. Okay, so category 2 was those areas where services were not fully implemented. They were probably new. Many of them came in the last budget cycle. So I'm going to detail for you itemized reductions in the areas where we have taken the cuts. There'll be a little bit of a disconnect of what you see in your budget report, and that's why I'm working hard to be as transparent as I can about how we have to take these cuts and redirect them into the most critical area. So you'll see cuts. You won't see the cuts on your paper, but I'm going to explain how the cuts, where the cuts are, and then I'm going to show you how and why we are going to redirect funds so that we can maintain current capacity for the demand for psychiatric crisis beds, which are an extension of our community-based crisis system. So bear with me for a minute while I attempt to explain a little bit here. Leave that for a second, Chris, because there's an element of our budget story that I have to tell you before you can understand the cuts and how they're going to impact the safety net. So, there is a big driver of the increase in demand in this state. You all have heard about there's more people are seeking mental health and substance use services, and there's a big driver. We have been in many cases meeting a good portion of that demand through community-based crisis services. In the settlement agreement with the Department of Justice that was signed in 2010, you may recall this. The push of the DOJ settlement agreement was reduce institutionalization, build community services. So when they anticipated we would close the hospital in Rome, there was an acknowledgement, you will close this hospital, you're probably still going to need some hospital beds. Okay, so what came in the budget and what you all year after year have approved in our budget is 35 what we call private psychiatric beds at the cost of $8.6 million. So since 2010, that's been in our budget. You all have granted that. What you didn't know is that every year, the utilization of those private beds has been increasing. The reason you don't know that is because we've had flexible fund sources. You gave us the $8.6 million. We kept covering the cost of using those psychiatric beds. Year after year, we covered the cost. We try to come to you only when we have a gap we can't fill. So we had flexible fund sources. Any unused money was all going into the utilization of private psychiatric crisis beds. We purchased these from hospitals around the state that we have contracts with. And again, they're not our hospital beds. Our hospital beds are for individuals who have long-term needs. The private psych beds are for short-term stays with the hope of returning people and connecting them with local community services. Where that has landed us, though, year after year, and in the last really 2 years, but this year in particular, as we went toward the budget cuts and the reductions, and we've lost some of the flexible federal funds that we previously had to fill this gap. Where we landed, we've been in full communication with everyone about this, is that we landed with a $13 million gap. We still need to provide those private psych crisis beds, but once we did our budget cuts, we landed with a $13 million hole. So I want to pull up the budget slide, because here's what's happening. And I'll walk through these, but I want to tell you one other element of the story. Remember what I said. You've been giving us money for 35 beds, which means they're used every day of the year, and that costs us $8.6 million. Year over year, it's increased. We're using closer to 95 beds per day because of the increase in the need for crisis services in mental illness and substance use. So that's what represents the difference between 35 beds and essentially 95 beds is what led us to our budget gap. So here we are, and then still having a challenge of making some cuts. So you can see across the board here, we've taken cuts in challenging areas. These are all cases where most of this money came to us in last year's budget. You all gave us core money last year. It doesn't show a cut there. But actually what we're going to do is, because we need that core money, but we more urgently need the money for the psychiatric crisis beds. So the $10 million that was originally in last year's budget has to be redirected in order to essentially fill the gap for private psychiatric crisis beds. And then in 21, you see the listing. It's pretty much the same between 20 and 21, all of these program areas, where then we had to allocate those reductions. These are the areas selected. And again, what it takes us to is the need to take cuts in painful places, but make sure, above all, again, we minimize the impact to people who have current and actual needs that we can calculate because of the demand in the private psychiatric crisis beds. Okay, next slide. Category 3. Are budget reductions that we took in areas where services were underutilized. We might have set forth on a program and it didn't have the need as much as we thought we would. So we looked very carefully in all of these underutilized services or contracts in almost every area. The program does not go away. It's simply a reduction in the amount that's available or the number that could be served. There is one item that I want to call out to you here. It's been an item of interest for a lot of folks. The final item on this slide is the Marcus Autism Center. And this one doesn't exactly fit in the same category, but we put it here just so we could point it out to you. What you know has changed in the last 2 years is that the state has implemented an autism benefit. So that's changed our relationship with Marcus. We're working closely with them. What we're trying to do is, as we always do, any services that can be billed to Medicaid, we want to bill those to Medicaid. We want to reserve state funds for things that Medicaid cannot pay for. So the cut you see here, we're actually negotiating with Marcus about where can Medicaid funds be used and where should we reserve state funds for services or training that cannot be covered by Medicaid. So we'll continue to work closely with Marcus to make sure that has minimal impact on the vital services that they provide. Category 4 are hospital operations. As mentioned, we have 5 state hospitals, and you see we did approach this a little bit differently. We could not take a cut at 6% across our hospital system. Our hospital system is pretty lean as it is, and so what we did across the board, we did a 3% reduction across the board at each of our hospitals. So you see each divided by how we appropriated those across, and then next slide shows you the total cuts and the amount that we yielded for the entirety of the hospital system. Also want to say we worked very hard to minimize the impact on employees. It's a hard place to work. We have many vacancies. There are positions impacted, but actually even as days go by, we're very optimistic that any individuals whose jobs are at risk as a result of the cut will be matched to another role within the hospital system. So we don't expect any full-time individuals will be impacted there. Great, thanks. All right, so what this slide does then, it's a summary slide, shows you the totals of Category 1, Category 2, Category 3, Category 4, and shows you how we've then gotten to our $34 and our $45 million targets. And we believe along the way, what we've done is we've taken more cuts than we wanted to in order to do the redirect and get us back to achieve the targets that DBHTD was assigned. Okay. All right, let me take a few moments just to mention the workload adjustments. Very good. So these should be familiar to you across every agency. You've probably seen these from all my other colleagues and other agencies. The one thing I do want to point out is the salary adjustment, the $1,000 for employees earning less than $40,000. This is a really big boost for the DBHDD workforce, particularly in our hospitals. And I want to thank the governor and his team for recognizing challenges we have with workforce, and it's a great time to be providing support, especially to our direct frontline staff. And then next, workload adjustments. Couple of items here, and two that I want to mention in particular. In DD, you see here annualization of our NOW and COMP waivers. Many of you are familiar. These are the waivers that serve individuals with intellectual and developmental disabilities. We have 13,000 individuals on these waivers throughout the state. Year over year, you've been allocating new waivers, and how you do that is you give us a portion and then we annualize it. You give us a portion and then we annualize it. So what you're seeing here, this addition, is the annualization of 125 waivers from fiscal year 20. I do have to note there are no new waivers in the forthcoming budget, so that'll present a challenge. The rest of the items are small. The other one I want to draw your attention to is that you have provided operational funding for a new 40-bed forensic unit. This is on our hospital grounds in Columbus, our West Central Hospital, and it's important for us to say out loud, we are not expanding our hospital beds in the state of Georgia, with the exception of beds for forensic individuals. This is a growing need in our state and every state, and really opening up the pipeline for forensic individuals who, as you well know, appear in jails and often are in need of mental health treatment. You all have agreed that this is an important need for the state. You gave us the operational funding, and in the end, we'll need annualization for that. Probably that'll be in 22. So construction of that facility is currently underway. It will be a big relief to the system when we have it. So I've said a lot, and we have a challenging budget. I want to acknowledge you all have been extremely supportive. I know many of you care deeply about the people that we're serving, and I thank you for your continued support. The safety net is stretched to the max, but we feel like we're in this together, and I do just have to acknowledge year over year how you've continued to acknowledge our challenges and try and find ways to support us. So we wanted to express our gratitude to you. I'd like to say more, but probably appropriate for me to ask if there are questions.
Well, there might be one or two. Chair Lady Dempsey.
Thank you. And thank you to your team and all who work with real people, because that's what this is about. I could feel the respect behind me. It's quiet. This is the quietest this room has been the whole time. There's not a lot of fidgeting or movement right now. This matters. I think it matters to everybody here, so thank you. The challenge is real. You've laid it out very well for us. I just want to remind everyone that in recent years, the House and the Senate has worked very hard to find money, to find money that wasn't always there, to increase the care and to build up this safety net. So as we look at these cuts, and we look at things like CSBs, and we look at those places where services are delivered to our people, real people who are fighting for their lives. The loss of services, it's hard to even imagine right now, and how we're going to deal with this and what we can possibly do, how we can continue to try to help. But I want to know from you, these reductions that really hit our safety net, how do we do it? The impact statement, I hope it's online now. We were provided it actually through the media very earlier in the process, but I believe OPB has made it available now. Y'all's very thoughtful, not only dollar impact, but the words that go along to the reality of the life-altering, life-changing, life-robbing impacts of this are so important. it rings through my head over and over, the outcomes. And I just want you to know that we need to know how to help you address this. The words that this will bring about increased suicidality, substance abuse disorders, and demands on our crisis services that we cannot meet. Those are powerful. Thank you for putting all of that together. And I know that's a broad question, but if there's any advice you can give us to help you help.
So, thank you, Madam Chair, for your compassionate leadership. And you all have been extremely generous in trying to find ways, because these issues have begun to hit home for everybody, right? It doesn't seem like something that's over there anymore. And that's become important for all of us. And again, I want to thank you. So I think, just to try and clarify the story as best we can, last year, there was approximately $10 million given in our budget for core funds. I can't tell you how many years we fought for that. What that represented to us, it's a capped system. We can't just spend whatever. The system is capped across the state. There's no more money. So when you serve everybody you serve, that's it. There's no more money. Last year's core money that you gave us was the first time in decades that there's been additional money. I can't tell you how painful it is to hand this back. Now, we had to, because that need for the private beds is just real. It's at our doorstep, at all of your doorsteps every day, so we didn't have a choice. What I think you are going to hear from advocates and providers, though, is we wanted that core money. That core money mattered for access. It was going to make a difference for mental health, for early getting in the door sooner in every area of the state. So they're going to be frustrated that we had to make the decision to redirect those funds into crisis beds. I absolutely stand by it's the right thing to do, but when you hear from advocates and providers to say, we can't improve access, we can't expand our reach, we can't serve more people until you give us more money, they're going to be correct. We're stretched, they're stretched, and so I think it's a challenge we're going to have to face together.
Okay, we've got time for about 2 more questions. Representative Gardner.
Thank you very much, Mr. Chairman, and thank you, Commissioner, for the compassionate and caring way you try to use all these state funds to help our people who need help. Recently, the Fulton County delegation went to the Fulton County Jail, and you and I over the years have talked about the need for crisis services in Fulton County. The Fulton County Jail has 20% more people than the jail was designed for. And those who manage that jail tell us that 20% of those people are people who need to be in a mental health facility. They are deemed to be dangerous to self and others and are a danger to our community. And yet, crisis services in Fulton County, there's no place for these people to go to get the kind of state services that are needed. So can you help me figure out how we can move forward before some incident occurs where these dangerous folks are let out into the community and something bad happens? It's a terrible situation.
I think it's a challenge, as it is everywhere. I have a few positive things to say, one of which I know you're familiar with. We are sitting down on a regular basis with Fulton County and working closely with them about doing exactly what you're saying, which is how do we improve access, and in fact, how do we get to folks earlier? How do we get them at the first sign of need, not when they're in crisis or not after they've committed a crime? So I think we're in a better place than we were even a year ago because those conversations are happening at a leadership level. The second thing I do have to say, that the Behavioral Health Commission that Chairman Tanner has now gotten underway, this is really going to be one of the main focuses, as we understand it, of the Commission's work, is to look at the intersect between the criminal justice system, whether it's Fulton County Jail, courts, judges, everywhere, because in every state in the country, this is becoming a challenge. We want people with mental illness to be served in the best location. I don't want them in the back of a sheriff's car in the same way the sheriff doesn't want that. So how do we move upstream? How do we get people access to the services they need? But the most important thing is we will keep coming to the table with Fulton County. We know their leadership is committed. It's helpful.
May I follow up, Mr. Chairman?
Very quick, very quick.
I will. When you meet with your colleagues around the country who are also commissioners of these kinds of services, and you look at state versus federal funding, I mean, I notice that our federal funding is abysmal compared to the state dollars that are spent for mental health. Is that typical, or how are the funds? Where do the funds come in other states? Are they able to garner more funds than we are?
So, thanks for the question. It's actually, if you've seen one state, you've seen one state. I do have many things in common with my fellow commissioners, some of whom do or do not have intellectual and developmental disabilities in their departments. Some of them do or do not have substance abuse services in their department. So it's a different snapshot all across the country. And it really depends on decisions made at the state level for how they access federal funds, including Medicaid, use of Medicare, all of that varies state by state.
Typical, mostly state funding in all the other states?
No, that is not typical.
Last question, Chair Lady Taylor.
Thank you, Mr. Chairman. I'll be very quick. I come from a rural community. You've been to my community. You know the issues that we have, but this budget is just, I cannot see how it's going to work. And spoonful of sugar is not going to make this go down. We have so many needs that are unmet now, particularly in rural communities. We need to go back and look at this because this is just not going to work. There are too many needs. I'm questioning now when I have constituents that come to me and say, I'm waiting at the local hospital for a bed for a week. Is it because we don't have money, or is it because there is no bed available? That is not acceptable. We can't do that. And again, I represent a rural area, but this is something that's very concerning, and I know we are getting our Medicaid money, getting what we can, but at some point in time, we cannot ignore this. We're not going to become a state that lets people just wander in the streets. This can't happen. Thank you.
I thank you for your passion, your compassion. Our rural areas are hard hit. I want to acknowledge that. And the commitment I can make to you is that every dollar that you give DBHDD, we will be transparent about how we're spending it, and we will do our best to get it directly into providing direct services to the people in need that we all care about in this state.
All righty, Commissioner, thank you for being with us. We are out of time, just a little bit over. We appreciate what y'all do and appreciate you being with us.
Thank you. Thanks for the opportunity.
Our next presenter is OPB Director, Mr. Kelly Farr. We may need to build some reversible toll lanes in the back of the room to allow traffic to pass. All right, everybody, if you would, please be quiet. Director Farr, thank you for being with us this morning, and the podium is yours.
Thank you, Mr. Chairman. Chairman England, Chairman Hill, and members of the committee, thank you for allowing me to come before you today to discuss the budget of the Governor's Office of Planning and Budget. I recognize that I am the last of a very long few days and the last guy before lunch, so I will do my best to get to it as quickly as I can, but be glad to take any questions you guys may have. For the Governor's Office of Planning and Budget, we'll be able to meet the 4% cut of $491,647 in AFY '20 and the 6% cut of $647,470 in FY '21. The way we're going to do that is through maintaining vacancies, reducing IT footprint, and IT staff. We are currently holding 3 analyst positions vacant, and we'll have plans to continue to do that. The other way we're also recognizing savings in our personal services is that as we have the more experienced members of our team leave, the people that are being replacing them, they're coming in at the entry-level salary of the role rather than the more experienced salary of the role. We are also transitioning away from on-premise homegrown IT applications, which will allow us to move from 10 servers to 6 servers with plans to reduce down to 4. OPB IT staff formerly consisted of 4 full-time employees and 7 contractors. Now we only have 2 full-time employees. I greatly appreciate this opportunity to present the plans of the agency, and will gladly take any questions you have about OPB's budget.
Okay. First question is Representative Hughley.
I'm sorry, it was a
Okay, I'll charge you later for the use of the light then. Representative Oliver.
Good morning.
Yes, ma'am.
In last year's budget, House Bill 31, there was a direction to OPB to do an analysis of where the Children's Trust Fund fees, divorce filing fees, marriage license fees going. Can you give me an update on that task that we gave you last year?
No, ma'am, to be honest with you, I don't have an update on it.
It's page 131, line 173, if you would check that, please, sir.
Yes, ma'am.
Thank you.
Yes, ma'am.
Next, Chair Lady Taylor.
Thank you, Mr. Chairman. I had a couple of questions, and I had several examples where you were indicating repeatedly in a lot of different categories. Contractual services are being eliminated, personal services, and one of them that really bothered me were other funds going to be used. There was no pattern. I'm trying to figure out what that really means. For one thing, I'm concerned, are we transferring things back to local governments?
Are you talking about OPB's budget?
Yeah, there were several things I'm looking at.
I'm not aware of any other funds.
Okay, you don't have anything to worry about. All right.
Yes,
but there were some things in there that said other funds would be used, and what other funds are they?
I think she's talking about kind of throughout the budget.
Throughout the budget.
The entire budget.
The entire budget.
Oh, the governor's budget proposal?
Yeah.
I mean, I'm here to talk about OPB's
Just yours,
budget.
okay.
I think the governor did a good job with his proposal the other day, and I don't have anything to add to it.
Vice Chairman Perkle.
Thank you, Mr. Chairman. Well, not directly related to OPB's direct budget. We had many commissioners, we had many department heads that moved through the last 3 days, and we've looked at we've looked at a lot of cuts.
Mm-hmm.
In your opening statement, you mentioned IT and technology, and that's one of the things that there was a prevailing sentiment about using more technology and mobile this and doing video conferencing and trying to cut down on travel using technology. And we've also looked at significant cuts in IT budgets and in technology. And one of the scary things was we'd have one department that came in and says we're going to save money by using this new technology. Department of Corrections, I think, yesterday, and Department of Revenue the day before said we're going to save money by getting rid of this technology. And it seems to be a dichotomy, a juxtaposition that there seems to be no rhyme or reason, that we're going to use this technology and we're going to be able to meet the budget cut, or we're going to implement technology. And would you help me understand that?
Well, I mean, I'm not going to speak on other commissioners' budgets. I don't think that's appropriate. But I will tell you, as it relates to the Governor's Office of Planning and Budget, we're moving from, and it's not just at OPB, I think it's in all of business. We're moving from this environment of deploying on-premise server-based applications that need a lot of resources to keep patches going, to put in quick fixes, all of that type of stuff, to a more agile, more quickly deployable, cloud-based kind of application-focused technology. And so through that kind of paradigm shift, you should be able to not only save money, but also deliver services from a technology perspective in a better and quicker manner.
Chairman Watson.
Thank you, Mr. Chairman. Director, appreciate you being here.
Yes, sir.
My question, I guess, is kind of similar to Chairman Perkles, and it's not directly related to the OPB budget, but kind of the overall governor's recommendation and OPB's recommendation concerning the $1,000 raises and how that number was determined, and the 40,000 mark, and were they kind of a performance-based type system? Will employees that have been here 1 month get the same raise as employees that have been here 5 years? Were there any components to that recommendation, and how y'all move forward on that? And do we have like a list of everybody that's included in that and their title?
So the House budget analyst, the Senate budget analyst, they're meeting with my staff right now, and we're giving them the detail we did to calculate the numbers we have included as part of the budget for the pay raise.
Okay, thank you.
Yes, sir.
Chairman Welch.
Thank you, Mr. Chairman. Director, good afternoon.
Yes, sir.
Good early morning, late afternoon. I wanted to talk to you. We spoke the other day, and I wanted to relay to you some information that we had discussed before regarding public safety. We talked about, and we talked to the commissioner about this, about the vacancies or the elimination or freezing of positions within the Department of Public Safety. The commissioner came in and gave us a report that he was going to freeze about 45 positions in the amended budget, and 55 positions or so in the 2021 budget. I asked him how that was calculated or how that was determined. He pointed directly to your office and said that was calculated by OPB as a mathematical equation to determine the amount of money to be saved. And I asked, well, what's the methodology for those positions being frozen? Is it the duration of time that they've been vacant? And again, it was pointed back to OPB. We talked about that, and I know that you have a methodology for what you would think that's appropriate. So could you just elaborate on that from the office's perspective, since I can't seem to get a straight answer out of either one of them? You've given me some information, he's given me some information, but I'm trying to figure out exactly how to understand what positions we're cutting, why we're cutting those positions, so that we can make a public policy decision as appropriators.
Sure. So, again, I don't want to speak specifically about people's budgets, but the one thing I will say about the methodology was, when we calculated that, we looked at people's labor distribution, right? We looked at the jobs that have been vacant. Some of them have been vacant for quite a while, and that was what we used to create our analysis. Now, remember, that was probably done, October, November timeframe, and we've tried to true it up as we keep going through the process. But all of that's done on a day and time snapshot. And so, whether they hired a vacancy after we had recommended they not, I don't have the answer to that. That was kind of why we implemented the strategic hire process. But then again, I don't know how it is with you guys, but not all the agencies listen to us either as well. So we do our best in trying to calculate it, and like I told you the other day, we'll be glad to show you anything we got.
Chairman Knight.
Thank you, Mr. Chairman. Director, thank you for being here. Another question is not necessarily related directly to, OPB specific budget, but in regards to the marketplace facilitator legislation. I know that was very important that we get that done. In fact, I believe the state economist was like, it needs to be done now and, signed and out the door. But is the governor going to increase the revenue estimate to recognize the revenues from that, marketplace facilitator legislation? And, have y'all talked about that as far as the revenue estimate?
No, we haven't talked to about it, and I certainly can't speak for what the governor would do, but if you ask my advice, the one thing I would caution him on is using estimates to change anything, right? I mean, that's kind of why maybe we're in a little bit of the challenge we are right now, is because a lot of people relied on the estimate from when the 25 basis point reduction was made last time, right? And it didn't quite perform like we had hoped. And so I think it would be prudent, if the governor asked my opinion, to wait and see what the performance actually was of the marketplace facilitator legislation before making any changes to the revenue estimate.
Mr. Director, that appears to be all the questions that we have. Thank you for coming by.
Yep.
Ladies and gentlemen, we're going to take our lunch break. Remember that the federal public block grant hearings start in this room at 1 o'clock. So those of you that have interest in that, please be back for that as well. Thank you, and we are adjourned.